Welcome, everyone. Thank you for joining us today for our 2022 Reaching Home Summit. Many of you here are familiar faces, and some of you have been involved in this work and in the campaign for going on 15 years now. So thanks for joining us. And for those of you who are new to this space or dropping in to learn what is happening with homelessness in Connecticut, thank you and welcome. My name is Kylie Goslin. I'm the Executive Director of the Partnership for Strong Communities. The partnership was founded in 1998 and hold on one second, was founded in 1998 to focus on ending homelessness in a way that few other states had, to intently and relentlessly focus on the targeted investments and policy changes needed to prevent and ultimately end homelessness here in Connecticut. And in 2006, the partnership founded the Reaching Home campaign. Reaching Home is a collective impact effort made up of hundreds of partners, nonprofits, service providers, state agency partners, policymakers, individuals from the healthcare, criminal justice, education, mental health space, housing sectors, and so many more, all who have committed to unite behind the goal of making homelessness in Connecticut rare, brief, and one time. And we'll talk more about that topic later today. And as you'll hear today, Reaching Home is an organized effort by many partners, including the Connecticut Coalition to End Homelessness, Corporation for Supportive Housing, Department of Housing, Department of Mental Health, and Addiction Services, to name just a few. And we've worked together to identify and advocate for the investments and policy changes needed to prevent and end homelessness. Over the past 15 years, the campaign has advanced increased targeted investments in housing and services and seen the number of households experiencing homelessness and using shelter decrease steadily, in fact, by more than half during that time. And in addition, we've seen fewer people come back to the homeless crisis response system and shorter stays in that system. During the pandemic, the Reaching Home campaign and its many partners rallied to support our state's most vulnerable and came together within the campaign structure to direct new resources, organize new programs, and troubleshoot unprecedented challenges. Our crisis response system has worked miracles, protecting and housing thousands during this time. But our work continues and the fight to end homelessness in Connecticut goes on. Last week, some 1,900 individuals and hundreds more families had been identified as experiencing homelessness on our state's by name list. And the housing insecurity continuum in Connecticut is broad, with hundreds of thousands of households paying more than 30% of their income on housing, more than 120,000 paying more than 50% of their income on housing costs, thousands more doubled up or in unsafe housing situations, and many facing eviction. With some of the highest housing costs in the nation, there simply is not enough quality, affordable housing in the state for all who need it. This housing burden, of course, falls disproportionately on households of color, who have also been further burdened by the pandemic disproportionately. Those experiencing homelessness make up the most acute end of Connecticut's housing insecurity spectrum. Today, we'll share more about the Reaching Home campaign, hear from partners on how we're organized, what collective impact is exactly, and the latest data and trends on how we're doing. We'll also share how we track the elements of the federal definition of ending homelessness, rare, brief, and one time. And finally, we'll share the campaign's legislative priorities for 2022 as set forth by the Reaching Home Coordinating Committee. Thanks again to our partners for being here today, and a big thanks to our Collective Impact and Equity Manager, Carlene Sharmless, for organizing today's event. A few housekeeping notes as we move ahead. You'll see on the screen the partnership's mission statement. We are in a Zoom webinar event, so you'll be able to see the panelists. And we are, I'm gonna turn to the housekeeping slide. Thanks. I just want to make sure I'm highlighting what you want me to highlight, Carlene. All right. I want to make sure we're using the chat box. Yes. If you have tech questions, please use the chat box and send your messages to PSC Zoom meeting host if you're having technical issues. If you have questions, we're going to use the Q&A box for this session. So use that in the Zoom control panel, and then we'll work on the Q&A at the end of our session. You're muted because this is a Zoom webinar and the event is being recorded. With that, I'm going to turn our session back over to our MC, Ms. Carlene.
Good morning, everyone. I hope you're all doing well this morning. My name is Carlene Chamos. I am the Collective Impact and Equity Manager at the Partnership for Strong Communities. And I'm super excited that you've all decided to join us this morning to learn more about collective impact and the work that we do. And just to get a good understanding of where we are all coming from, I want to take a quick poll of the audience just to see who's joining us and to gauge your level of awareness of collective impact. So we're going to be launching that in a quick minute. Looks like we are halfway there. Just waiting for a few additional people to fill it out. Thank you all for taking the time to fill out the poll. Just taking a quick look. I'm going to quickly share the result just so that you can see it. Looking at who's joining us this morning, we have a number of Reaching Home Work Group representative, as well as some community partner who's joining us this morning. Just a few individuals, we have some elected officials, as well as some of their representative or staff joining us as well. And then some other stakeholders who are interested in learning more about the work that we do. And then when it comes to collective impact, I see that we have a couple of people who are new to collective impact. So they are hoping to learn some new information. And there are a few of you who have learned about collective impact, but you want to learn a little bit more. And then there are a few of you who noted that you are a pro when it comes to collective impact. So we have a wide range of individuals with different level of awareness of what collective impact is joining us today. So I think we are all starting from the same space. So thank you everyone for doing this exercise with us this morning. Now, as Kylie noted, the Reaching Home campaign is a structure within a collective impact framework. So what is collective impact? To start, the collective impact is defined, as you can see on your screen, as the commitment of a group of important actors from different sectors to a common agenda for solving a complex social issues. And what this means in layman terms to me is that it is a commitment of people across different sectors, from government, business, nonprofit, and philanthropy, community members, individuals with lived expertise that are committed to working on a common, complex environmental or social issues such as homelessness, and they are doing it in a structured way that leads to change over time. And this term, it was coined in an article that was released in the Stanford Review that shared lessons learned, common patterns around what an effective collaboration looks like. And the article, it outlined five conditions of an effective collaboration, which includes having a common agenda, doing mutually reinforcing activities, having shared measured, continuous communication, and a backbone support. And on your screen, you can see the high level definition of what each of those different components means. So when it comes to the having a common agenda, it's like having a common understanding about the problem and a joint approach to solving it. And then for the continuous communication is that all the players who are engaged and the collective impact framework, are communicating on a regular basis to build trust and to assure mutual objectives and to create common motivation. And a few years after the initial article was published, the authors noted that they excluded two critical elements which are essential to collective impact framework. And those were engaging individuals with live expertise and having an equity lens to this work. So they realized that every issues perform differently when you begin to think about it in terms of race, and that collective impact needs to put equity at the center, from the structure by which the work gets accomplished to the programmatic and systemic work, as well as the data being collected and reviewed. And we know that there is a disproportionate number of people of color being served in the homelessness system, and that the current system was predominantly established and led by white leadership. So this lens calls for all of us who is at the table to make a conscientious and intentional effort to ask the difficult questions in terms of how does race factor into the decisions we are making, whose voices is missing at the table, and how do we ensure that we are not tokenizing Black, Indigenous people of color and those with lived expertise when they join the table. And what we know is that system transformation will require a shift in power to authentically engage Black and Indigenous and people of color and those with lived expertise in every aspect of the planning as well as the decision-making process. Now I'm gonna quickly turn down the slide deck so that we can start our panel discussion. While I do that, I'm going to ask each of the panelists to take a moment to share their name, titles and more in one sentence describing their organization and the role that they play within the campaign. And then we'll start that with Kelly.
Good morning, everyone, and thank you, Carlene, for inviting me to be a part of this discussion. Hi, everyone. My name is Kelly Fitzgerald. I'm Senior Director for Financial Stability at United Way of Greater New Haven. And in a nutshell, we are the backbone to the Greater New Haven Coordinated Access Network. And in regards to the Reaching Home campaign, I'm a member of the Sustainability Committee, as well as the co-chair of the CAN Homeless Delivery System Work Group.
Thank you, Kelly. I'll point it to Stacy.
Good morning, everybody. Happy to be with you this morning. I apologize that you can't see me because we're having some technical difficulties this morning. So you have the logo there for the Center for Children's Advocacy. I'm Director of Operations and our Homeless Youth Advocacy Project at the Center for Children's Advocacy. We are a non-profit law firm representing low-income children and youth. And we provide individual legal representation as well as policy advocacy for children and youth. And as part of my work in the campaign, I sit on the Prevention of Homelessness Committee. I am a tri-chair on the Youth and Young Adults Statewide Task Group. And then I sit on the Reaching Home Coordinating Committee. Thank you for having me.
Thank you, Stacy. And then I'll pass it off to Steve and followed by Caroline.
Hello, everyone. Thank you for having me. My name is Caroline Beltray. I represent Women and Family Center, where I am a case manager for homeless and runaway youth. And I also serve a dual role in the sustainability as well as Reaching Home, in that I also come to you with lived experience. Thank you for having me.
Thank you for joining us.
And I'm Steve DeLell, the Director of the Individual and Family Support Program Unit at the Connecticut Department of Housing, and we oversee the state's response to homelessness. And I never knew. I've been on all these Zoom meetings this entire time, and I never had an account, and I just had to set one up today, and that's why I'm kind of late. Weird, huh?
I'm glad that you were able to join us today, Steve. And I think every day is we're learning every day. So I'm glad that you were able to join us. So I'm going to pass it off to Chelsea to introduce herself. And at the same time, I will put the first question to you, Chelsea. So after introducing yourself, if you could just quickly really share in our role as the backbone organization, how do we use collective impact, the collective impact framework to further the work to ensure homelessness in Connecticut is rare, brief, and one time?
Sure. Thanks, Carlene. Good morning, folks. And I literally cannot believe that you made it this far without a Zoom account, Steve. I'm impressed, very impressed by you. So my name is Chelsea Ross. My pronouns are she, her, hers, and I get the opportunity to work for the Partnership for Strong Communities, supporting our collective impact for both the Reaching Home campaign and the Home Connecticut campaign, which works to address affordable housing issues in our state. I serve as a deputy director, and I believe that housing is a human right, and focusing on supporting convening and policy analysis and education is really the sweet spot for me, and supports our work in making homelessness rare, brief, and one time. So, Carlene, you asked about backbone support. You gave a great collective impact 101, and I'll share a little bit about how we operationalize that from the perspective of the backbone organization. And although history was my least favorite topic in school, sorry, Dad, I think really the best place to start is in the past. Kylie talked about how we came about. Reaching Home was launched in 2004 by the small group of folks working in collaboration with the idea around ending chronic homelessness in Connecticut. And 18 years ago, the focus of the campaign was really on the creation of supportive housing as a solution to ending chronic homelessness. And today there's, more than 5,000 units of supportive housing in more than 80 municipalities across Connecticut. And a goal like that was really only going to be met with a high level of coordination and collaboration across different partners. So enter collective impact as a model to support that happening. And Carlene talked about the 5 different elements. Collective impact is a fancy way of saying, number one, get a bunch of people together on a common agenda. You need a common understanding of that problem and a joint approach to solving it. So in this case, around reaching home tables, we believe no one should experience homelessness, and chronic homelessness was a significant concern when the campaign launched. And we knew that the housing and services of supportive housing were the best way to reduce people's experience of chronic homelessness. Number 2, develop some shared measurement, right? You have to keep everybody on track by deciding how your success and progress towards your goal is measured and reported. So today you're going to hear from Bo Anderson about sort of how we've done that historically and how we're trying to do that moving forward too. Number 3, everyone has a role and a to-do list as part of the plan, right? And those to-dos have to be mutually reinforcing. That way we build on each other's work and successes and get to the goal quicker. So that's a big part of what Carlene and also Danielle Hubley at the partnership spend time doing, attending every work group meeting, talking with partners, and trying to make sure that what's happening over here is coordinated with what's happening over here, so that the work of everybody, we all kind of know what each other's are doing, and we're working towards the same goal. And number 4, that communication is key. Like any team, that open and clear communication builds trust and helps us refine our plans as we go and stay motivated and focused on a goal. And then 5 is that statewide effort that brings together diverse organizations to share leadership and drive toward a common goal. Really needs that backbone organization to support the vision and strategy, coordinate the structure and the activities, mobilize funding, which I'm not sure Carlene touched on, and advance the policy work. So with the support of the Melville Charitable Trust in 2004, the Partnership for Strong Communities took on that role of backbone support for Reaching Home. And that role has ebbed and flowed and changed over the last 18 years. Fast forward to 2010, the federal government released the first comprehensive plan to end homelessness called Opening Doors. And each state was tasked with making a plan to make that plan work. But fortunately, Connecticut already had a 6-year start, on working together. And so they went to work on adapting the federal plan to meet the unique needs of the state, and ultimately expanded and shifted from the focus of solely folks experiencing chronic homelessness to seeking to end all forms of homelessness. And then again in November 2019, which feels like yesterday, but also a lifetime ago, which is a little strange, the campaign embarked on its third phase of work, which was launching this new statewide goal that we currently organize under to make homelessness in Connecticut rare, brief, and one time. So we have our number one, our common agenda. We all agree that we want to make homelessness rare, brief, and one time. Whether you're an outreach worker, whether you're a youth with lived expertise of homelessness, a program director with Department of Children and Families, we're all here together agreeing that homelessness is unacceptable and solvable. We're also organized in 5 work groups, which some of the panelists touched on their membership in that. Members bring the expertise of the sectors and geographies that they represent and collectively determine the campaign's approach and those mutually reinforcing activities that they prioritize. So you have the prevention work group is the primary group of folks focusing on making homelessness in Connecticut rare. The coordinated access network / homeless delivery system, we call it the CAN HDS work group to really make sure we have a full alphabet soup. That's the primary group of folks in the campaign working on making homelessness brief. And the sustainability work group, that Kelly mentioned, is the primary group of folks focusing on making the experience of homelessness one time. We also have a resources work group, which Steve serves as, and they identify new funding opportunities, maximize existing resources. And that membership is comprised of key leaders from each of the state agencies. And their buy-in and involvement and leadership has really been key across the history of Reaching Home, not just in the present. And then the data and accountability work group. They are charged with defining, measuring, and analyzing campaign and system metrics. And you'll hear from just a bit from one of the chairs about how the campaign is utilizing shared measurement. So representatives from each of the work groups, folks with lived experience of homelessness and housing insecurity, key advocacy organizations, housing and homeless service providers, state agency representatives, they all make up a coordinating committee that coordinates the work of the campaign. And several of the other panelists will talk about their specific roles and areas of focus within the campaign as we all work together. And for better or worse, we all spend a lot of time on Zoom together lately. From one-on-one calls to utilizing Basecamp, which is a shared communication tool of the campaign, to this convening today. Reaching Home attempts to maintain continuous communication as a central strategy in keeping us all connected and working together. But, Carlene, you asked me the backbone support stuff. That's not the real work, right? That's not the real work. It's my work every day, but that's not the real work. The critical, diversion services that are happening each day across the state is the work. The coordinated access networks that have taken an incredible level of coordination and continued work to become the single entry point and system to connect people to stable housing as quickly as possible is the work. The implementation of statewide programs for high utilizers of healthcare and justice systems like the Connecticut Collaborative on Reentry, the newly launched CHESS program, Connecticut Housing Engagement and Support Services program, releasing the first statewide plan to end youth homelessness and conducting the first statewide youth count, receiving federal funding and implementing the youth homelessness demonstration program as the work. This is the stuff that we come together and that we create the structure to accomplish as a state. That's really the work. So later in the summit, we'll talk about the campaign's legislative agenda, which is a challenging but really important part of Reaching Home's work to advance, policy and drive resources toward ending homelessness. And there's so much more that the coordination of extremely dedicated people across nonprofit, for-profit, and government sectors has resulted in. And it's that collaboration that I know has been the key to the past successes in the last 18 years. And I firmly believe is the key to our continued success, and that homelessness is solvable. And that's why we come together.
Thank you, Chelsea, for really sharing how the structure we've used really has helped to propel the work that we do and how we engage as a campaign within that. So moving on to some of our other panelists today, can you speak to your experience participating within the campaign as a member, and what does that partnership look like? And what are some of the work that we've been able to collectively accomplish together? And Chelsea's talking point earlier, she noted that we've done some really great work together. So from CHEST, and I'm not going to attempt to define that acronym, to some of the youth work we've been able to do together. So I just wanted to quickly ask you all that question. What does that participation and partnership looks like from your end?
I'll take this on. So as a staff member of a state agency, is definitely an interesting process for us, because generally when you look at us, we are a funder. So a lot of times funders just make decisions based on what their goals are or what they see is needed. What I think is really important about collective impact is you get the viewpoints of all of the folks in the community that you're trying or with the problem that you're trying to address. So clearly in our case, that is homelessness. So it's not just us at the state level thinking that we know what is best and we'll just fund it as we see fit, and maybe even follow HUD rules or HUD regulations or HUD direction on that. But I think it's important for us to hear from folks that are on the ground, that are doing the work every day, from also our advocates and our nonprofit providers, to say, hey, no, this is truly what we need. How can we work together? That. And it's not just about funding too, because clearly that's how we get the programs up and running. It really is also about the types of services that are needed and the types of programs that should be created to really be effective at ending homelessness. So it's really a great opportunity to just come together and then really have these discussions with a wide variety of people to really understand what the true problem is and what are potential true solutions to that. And I think that is really what the biggest benefit we've had through collective impact is. We've been able to see the issue of homelessness from a wide variety of viewpoints, and then really come together as a group and say, okay, even though we have different viewpoints, even though we're seeing different things here and there, this is how we all agree on how we should move forward. And then based on that, that's when the asks come, and that's when our advocates do the work that they do to really try to get us the resources that we have. So I think that really is the most important part, is just being able to come together, analyze the problem, and then agree on what the best solution is to move forward.
I'd be happy to speak to this for a moment. Again, apologies, you can't see me, so I will just jump in. I had three thoughts about this. One is that I think that through collective impact, we have the ability to better apply for funding opportunities that come along. I think a couple of pieces of evidence around that are 2 rounds of the federal youth homelessness demonstration project funding, and the way that Connecticut was able to show its coordination in order to receive 2 of the largest grants that were given out nationally. As well as a more local project we just recently started in Stamford around case conferencing for minors experiencing homelessness. That was a funding opportunity from a national organization to help us and support that work. I think also, I would say the ability to coordinate legislatively. I really came to the campaign not in the homeless services sector, as a legal rights organization working with children and youth. I was working in sort of other circles and sectors, child welfare sector, legal rights sector. And we had a group of people meeting around youth homelessness, but it wasn't really till we joined the campaign that we were able to get a needs assessment that helped to show to legislators and policymakers the extent of the issues. That, as I said, we were able to get federal funding coming in. We were able to coordinate across different groups of people. So I think that it sort of comes to my third point, which is access to policymakers and decision makers, and the ability to share critical on the ground information with those folks. So I think another example of when we had to do that was during the pandemic, when we held a convening with youth and young adults to talk about what was happening for them during the pandemic, what their needs were. And the Youth and Young Adult Task Group, of which I'm a tri-chair with Angel Cotto, who is a youth with lived experience and a researcher, and then John Lawler, who is a provider to youth experiencing homelessness. We were able to take these issues, thoughts, ideas that young people had from that convening and share it with the resources work group, which is state agencies, philanthropy, and other folks, to have them know directly from young people what their experiences were during the pandemic. So I think access, I think this communication and coordination, and I think the ability to apply for funding are all benefits in the ways in which I think we've been able to work together through this collective impact framework.
Thanks, Stacy and Steve, for that. I mean, I would just definitely echo everything that you both shared. In terms of what I would want to add from my experience is, participating, like what I've loved about it is being able to come to the table with other agencies and groups from across the state, right? Like there's actually not a lot of other sectors and work that consistently brings people together to be able to share those different perspectives. And it's a group that, like, connecting back to that common agenda and shared accountability, I think we have all agreed, like, what are we striving towards, and really not wanting to stop until we're there. I mean, I've seen over the last 3 years, constant discussion around continuous improvement. Like, how are we doing this better? How are we doing this better for the client, right? Like making sure the people are at the center of the work that we're doing. And yes, wanting to see that in the data, using the data as a way to measure if we're making progress, but just always asking ourselves, how are we doing this better? And using the structure of the campaign to have those discussions. Another piece, though, that I want to share that I just think we can't ignore is collective impact during a pandemic, right? Like, what does it look like the last few years? And I would say that we saw a lot of success in the relationships and the structures that were built through the campaign to be able to use those to then quickly respond to needs as they came up. And so one thing that we saw success on was being able to come together to address the impacts of COVID-19. Like what now was 2 years ago, losing track, like having to decompress shelters, like coming together instantly and saying, this is no longer safe for staff and clients. What are we going to do? And so working together as a state, working with our state partners, Connecticut Coalition to End Homelessness, Department of Housing, like how are we going to address this? And we were able to do that. And that's also an example of where you can use collective impact and still make things happen quickly. I know that sometimes is some discussion of like, we're having this conversation again, or when are we going to see progress? But that was an example of where we were able to come together, talk about what we needed across the state and make things happen quickly. And so that's been, again, I think a lot of the work we've been doing the last few years.
Thank you. Thank you all for sharing your perspective around some of the work that we've been doing and how you are engaging in the campaign. I think a few things that I started to hear, you guys are started mentioning some of the benefits around working within the collective impact framework, the communication aspect, some of the collaboration work that you've all been able to do, being able to hear from the people on the ground. So I want to continue on with that same theme and really continue to ask you all, really, what have been some of the pros and cons from your perspective working within the collective impact? So I know collective impact sounds like a simple model. We have the 5 elements of collective impact, but it is really hard. It is not a formula that you can just apply and that would work for all communities, and it needs to be adapted and the pros and cons mentioned and it needs to be adapted to each communities, to each issues that we are working on. And it is deeply impacted by the personalities who are at the table and each person who's involved and engaged in this work. So I wanted to open it up in case you had any perspective to share about some of the pros and cons to this work.
Carlene, I'll jump in on this one, and I'm smirking just because we all know that there are pros and cons to the structure and the work that we do every day. I don't think we change it, right? Like we still show up, we still do the work, but acknowledging those things I think are important. I think a pro is we know that when we come together and we have one voice, we achieve better outcomes, especially when we're talking about advocacy and public policy. And so when we see that, like, you know, all the stars align and we get to that point, like we know and we've seen the outcomes align with that. I think the challenge is the process of getting to that point. I mean, I think one of the pieces around collective impact is like losing power, right? That like, it's not only about what I want, but it's like creating space at the table and giving everybody access to that same like sharing perspective, decision-making. And I think just going through that process, I think it takes time for everyone. Sometimes you have to determine, like, is what I want actually more important than the collective, right? Like having to really be reflective of how you show up in the space, but also being able to support others and create space for others to share their opinions, their perspectives in the process. So I would just say that the con is more just needing to be able to share power and come to the table in a way that you really want to listen to others and you're open to their perspectives and you're able to say, like, what does the collective decide is the next step, not just my personal opinion.
I can echo some of what Kelly said, because I think I've articulated what I think some of the pros are, but it is challenging as a person who's been working with these providers for a long time in the youth space to say, okay, let's, you know, the ideas that we've generated around legislative advocacy, which is a process that I, despite the fact that it has the, you know, herding of cats feeling to it, I do always enjoy, because it's really about what are you seeing? What are the most important issues that you're experiencing? Whether that's the young people on our youth and young adult task group, or that's the providers on our youth and young adult task group, or it's the state agencies who've been in national conversations with other communities across the country who are hearing about work in other areas of the country. You know, so bringing all of that together, and that soup that you get, that you're kind of stirring and putting in the right ingredients. And then in the end, you have to choose, to keep with my soup metaphor, you have to choose one flavor, at the most two, to bring up through the campaign, because the number of work groups and the number of issues and the number of items that have to be defended, whether that's a budgetary amount that has to be defended in the current legislation, it's challenging to just come up with 1 to 2 at the most issues, because that process generates a lot of ideas. What we have done is have the campaign support other issues, even if the campaign wasn't the sole driver of the issue. So an issue that might come up, everybody could agree would be important, but might not be on the agenda of the campaign, but was vetted through the campaign and might have the support to take it on separately. But I want to acknowledge that really, you know, difficult process of picking a particular issue to legislate for legislative advocacy.
So I think there are a couple of things that I've captured from your conversation, Kelly, and from some of the things that you noted, Stacey, around the vetting process of the legislative agenda, and then the work around sharing power in a way. So I want to shift to that a little bit more. So we know that shifting power to those with expertise and BIPOC individuals is something that, as a campaign, we are working to work on, and the coordinating committee has identified that as one of its top priorities. Could you all share, a few of you share some of the ways that, you know, the campaign has begun some of that work and some of the barriers that we have experienced as part of that process, and then also note some of the opportunities that could be explored to really help strengthen that work. I know this is a very challenging question in general. So I'll give you a few seconds to think about it, because in this work, we really have to be intentional, really in our practice, and we really need to ensure that the way that we are doing it is meaningful. So I don't know if you guys had any insights that you could share to that, and in general.
No, you go ahead, Kelly.
I was just going to jump in to say, I mean, the first step is like naming that this is a priority. And again, as we talked about common measures, like I've been happy to see the coordinating committee as an example, like name a percent. Like, my apologies, it might be 30%. That might be wrong. Carlene will correct me. But I think being able, I mean, taking that stance and saying this is a priority and this is what it's going to take for us to get there, and holding ourselves accountable to that has been a really important first step for me. I mean, I think for us, and I am glad to see us doing that. The other thing, though, that we've been talking about is like, how do we have to change the way that we meet, the way that we recruit, the way that we're supporting people in order to make it like a meaningful experience for people with lived experience and make it more accessible for them to join us. And so again, mention like connecting back to what I said before around giving up power, like giving up what we're used to of like, okay, we're going to meet at 9 in the morning. I don't know, like, does that make sense? Or how are we connecting new members who are new to the campaign, new to the sector? Like, how are we connecting them with a mentor or someone who can be there to answer questions and things of that nature? So those are all the pieces that I'm seeing the campaign put in place in order to make sure that we're truly able to recruit and support people with lived experience to be at the table and to have a louder voice at the table.
And I totally agree with everything you just said, Kelly. And I think the importance of this is with our work, we really are trying to make the system as responsive as it can be to those folks who are actually experiencing it. So what better way to be able to modify our system by actually asking those folks who've experienced the system on what they see as strengths and weaknesses. Oftentimes, you know, even though we may look toward our frontline staff and our private nonprofits to really guide us in some of this, oftentimes they will still come with their own programs or their own thoughts or their own biases. And sometimes we may not see the actions and the decisions that we make, how that actually affects people who are in our system and who are trying to get housed. So this is why this aspect is really important, because, you know, I think we have done a good job in pushing the system along. I think before, you know, we only had a couple of different interventions that were really able to address homelessness, so really, really blunt objects. And I think we've gotten a little bit more refined by creating different programs. So once again, these are programs that are, you know, funded at a national level, whether HUD comes up with ideas or whether pilot programs that we've certainly done in Connecticut come up with ideas. But I really do think the next area is, you know, what are the things that people who are experiencing homelessness need to get out? And one lesson we've truly learned over the last few years is, the blunt objects don't work. It works for a lot of people, but everybody's experience is different. Everybody's coming into the system for a different reason. So we also need to tailor our response to really meet those needs and try to figure out, okay, well, this person really does need permanent supportive housing because they have some barriers to housing, while this person may only need, this really, really light touch. And I think, having people who've gone through this really can help inform how we push the system forward.
I think I'll jump in. Steve, you're talking about how folks with lived expertise can inform the campaign. And I think one of the things that I've heard the coordinating committee and just all of us, right? I want to note that we talk about like the campaign. There is no campaign. It's a group of people. So when we say the campaign chose to, the campaign supported, we're talking about all of us, right? It's not a separate entity. And so I think that's been a shift too, is understanding and placing accountability on ourselves to do the work and to take accountability for making space. But, Steve, you talked about informing the work. And I think the campaign, we are working hard to switch from a community informed framework to a community led and driven framework, because I think we're acknowledging that those are two different things. It's one thing to get feedback and input from people with lived expertise and people on the ground. And it's another thing to, as Kelly talked about, make space, share power, and follow leadership of people with lived expertise and people on the ground doing the work. And that's what I've seen members of the campaign, across the campaign, figuring out, how do we do that? It's foreign to a lot of us, and it's not been the way that we've worked historically. But I've heard agreement that we need to do that moving forward to really achieve our goals. So Kelly noted, I think it's 35%, Kelly, but Carlene will also correct me, having a goal of increasing membership of the committee, and not just representation, but leadership, and focusing on that. Carlene has also been really instrumental in developing a colleagues program across the entire campaign, which pairs members who've been working in the campaign for a while with any new member, inclusive of folks with lived expertise or beyond, to try to implement those organizational changes as a backbone support staff to remove barriers and create a more accessible and inclusive culture across the campaign. And I think to go back to where I started, is recognizing that that's on absolutely every one of us that sits at every table. It's not a colleagues program. We can't sort of program or organize our way to equity. It's a personal journey too. And so I think in the melee of the last 18 months, 2 years of COVID, and trying to make sure that we're really supporting folks experiencing homelessness and doing the work to change our systems and structures and the way we operate and the way we as individuals show up in spaces, trying to do that concurrently. To go back to your pro and con, I think that's been a really big challenge. And it's been a pro, I think, of the growth that I've seen lots of people wanting to engage in over the last 2 years.
I want to bring in Caroline into this conversation, because Caroline is brand new to the campaign. I think she's only been engaged with us for about 3-4 months now. And I would really like to hear your perspective around, as a new member, what had motivated you to join us? And, what is your initial impression so far of the work that we've done, and some of this conversation that we've just been having around how we operate in some of the programs that we've been able to work together collectively and achieving? And what are your hope? What is it that you're hoping to achieve being engaged within the campaign?
Carlene and all members, thank you so much again for having me here. I am honored and humbled, first of all. I would want to thank my organization, Women and Family Center, who actually my director, Carissa, thank you for thinking of me and bringing this and asking me, hey, is this something you're interested in being a part of? And For me, I have two reasons. One being I'm a case manager for homeless and runaway youth, and the barriers I've seen them face in trying to find housing and obtain housing hasn't been easy, even with COVID. You know what I mean? And for myself, I'm also a person with lived experience. I've lived with or dealt with homelessness for the past 6 years, homelessness and unstable housing. And I've been in Connecticut for 5 of those years. I came here as a domestic violence victim and am still struggling to obtain housing. So when I was approached about this project, I was absolutely on board because I wanted to know more about it. I wanted to know what exactly is collective impact and how that will help shape and change homelessness. And I am absolutely on board with the fact that it takes a village. It takes a lot of sectors, cross sectors, to make an impact. And it's also a learning experience for me. I didn't realize how many sectors needed to be involved, what the red tape was, what the barriers are. I'm learning and growing a lot. And in the time that I've been here, in the short time that I've been a part of the campaign, I have seen the passion and the dedication that people have in wanting to end homelessness and being very intentional in making sure that all T's are crossed, I's dotted, in that when you include someone with lived experience, you're really listening to that person and what they've experienced as far as barriers they faced. So I am excited to see what else happens and how we move this along together. And I appreciate the opportunity to provide my experience. So what I'm looking to see is what changes I can help make to make it easier for a youth that doesn't have a place to go and is seeking housing and is involved in the rapid rehousing program to be able to obtain housing without a lot of the barriers that are in place, such as lack of credit history or lack of long-term employment history. So that's where I'm coming from. Does anyone have any questions?
Yes, if you have questions, please feel free to add them to the question and answer box, and we will try to get to those in a few minutes. And I know we are running out of time. I have one last question, and any one of you could address this question. And it's a very simple question. So, why is this a framework that you continue to participate in? I think you've already responded to that question based on all of the information that you shared earlier. But like in one sentence, why is this a framework that really is something that you want to continue to engage in? Why is this campaign something that you continue to engage in? And I see Caroline put her hand up. So we'll start off with you, Caroline.
Like I said, it's for me, it's two reasons. It's dual, it's personal. I have lived in my car before. I know what it's like to be out there and, driving by people's houses and wondering how warm they are, or seeing my residents looking for housing for over 6 months and not be able to find anything. So at the end of the day, I can put it as short as possible. Everyone deserves to have a home.
Hear, hear, Caroline. Hear, hear.
I was just gonna say, how do you follow that? That one. The only thing I want to add is, I show up every day in this space because it is my obligation. Like the only way collective impact works is if we all participate, right? And not just showing up, like not just putting your name down that you attend meetings, but really coming to the table, sharing your perspective, sharing ideas, asking questions. to get to that final result. I mean, if we don't do that, if we're not all showing up in that way, then it's really not collective impact at the end of the day. And I just want to make sure that I'm able to represent the groups that I do, whether that's the Greater New Haven Can, whether that's United Way, right? Like I want to be able to bring that voice to the conversation. And so that's why I do it.
I'll jump in here. I want to echo something Caroline said, which was, I heard you say really listening. And for me, that is the part of the campaign that I think is critical. Young people are telling me exactly what they want. And to take that and access all of you with that information, to stand side by side with one of my tri-chairs, Angel Cotto from the Youth Action Hub, who wasn't able to join us today, and to be able to speak exactly about what it is young people are saying they want, that is powerful to me. If you'll forgive me, Carlene, I'd love to give 2 examples of that. Do we have enough time?
We do. You can go ahead.
So 2 examples are, one was earlier in the campaign where young people had said to us there was a part early in the system that was not working for them. And they worked collectively with that part of the system to research the issue, here to canvas young people on what they wanted, and gave that feedback directly to that part of the system, who then adjusted what they were doing in the ways that they were able to within their funding. Was it everything the young people said they needed? No, I don't want to sugarcoat this, but was it a great improvement? Yes. I think the one other example I'd like to share is that we've been talking about, and it started during the pandemic, that young people need more ways to convene with each other, and that they needed more drop-in opportunities, which clearly during the pandemic was problematic since people couldn't physically be together. And so it was the Youth Action Hub who took up the idea of creating virtual drop-in opportunities. And they have been workshopping that idea, talking to young people about it, talking to lawyers about the liability of doing something like that. And it's got legs right now. They are moving that idea, which came directly from other young people and from state agencies saying what has worked with their populations. So for instance, Demas Young Adult Services gave some of the expertise that's worked with the population of young people that they've worked with. And that fed into the idea that the Youth Action Hub had. We're very lucky to have the Youth Action Hub funded through multiple sources, but mainly through the Melville Charitable Trust, so that they are able to be paid and have employment to do that work. So I'll stop there, but I thank you, Carlene, for giving me the latitude to give those examples.
No, thank you for sharing. So I didn't know if anyone else had any additional last thoughts that they wanted to share before we move on to the next item on our program.
You know, I think Caroline, I echo Kelly, although I love Stacy, your examples. I wish we had ended with Caroline. So I'll try to bring us back to that before we take a deep dive into data, is that, you know, this has been my career working on homelessness issues, and I get to work for the Backbone agency and support all of you in your work. And I sometimes say, you know, my work isn't life or death, right? Like getting the agenda out for the meeting or finishing up the fact sheet or those things, like that isn't life or death. But I show up because collectively our work, I know, is life or death for people, right? And Caroline said no one should experience homelessness. And I think we all deeply believe that. And, you know, my email or my fact sheet or my conversation with a legislator isn't life or death, but the impact that all of our work has is. And so I think all of us try to come every day, remembering that and showing up, as Kelly said, with that obligation, knowing that homelessness is unacceptable and it's solvable. And so I just appreciate watching everyone's dedication to ending it, noting that we can do that. So thank you, Caroline, for being so inspirational.
Thank you also.
I just wanna, as we end this panel conversation, I just wanna say thank you to all of our panelists for really joining us for this important conversation and for sharing your perspective and being open to sharing that. I know it's not always easy to talk about pros and cons. It's not really always easy to talk about personal experiences. So I appreciate that. And a few things that I've heard was like the opportunities to be involved and to actually do the work, because the work is important. And like Chelsea and Caroline noted, this work does impact everyone. And so with that, in the chat, I will add some additional resources for you all to learn about collective impacts. But now I would like to pivot us to really think about the shared and measured components of within the collective impact framework. So I'm going to pass it off to Bo from the Department of Housing, who will be providing us a data overview in terms of like where we are at and walk us through a new data dashboard. So Bo, I'm going to quickly pull up the slide deck for you in a moment. I'll do that right now. So, but I'm passing it off to you.
And Carlene, will you be advancing the slides for me?
Yes, please let me know when to go.
I will cue you. Thanks. So this is the one. Thank you, Carlene. Good morning, everyone. My name is Bo Anderson, and the pronouns that I use are he, him, and his. I am a statewide CAN manager for data analysis at the State of Connecticut Department of Housing. I work pretty closely with all 7 CANs and all 8 CANs when it used to be 8. And I'm also a co-chair of the statewide data and accountability work group of the Reaching Home campaign. What I'm going to walk you all through today is a short review of some statewide data trends that will be on the first few slides after this. And then I'm going to introduce you all to a dashboard that we've been working on very hard behind the scenes with the Reaching Home Data and Accountability Work Group, as well as folks at the Reaching Home campaign and the data team at the Connecticut Coalition to End Homelessness, which is more frequently known as more commonly known as CCEH. And we call that the Rare Brief One-Time Dashboard, or the Rbot dashboard for short. And before I move on to the next slide, I also want to let you know that I can take questions. Probably would be easiest for me to answer questions at the end. But if you submit those through either the Q&A or the chat, and I'm also going to ask that my friends at PSC monitor that for me so I can keep an eye on the slides and the notes that I've scribbled down while sort of waiting for my turn today to speak. So it's okay to go to the next slide, please. First, I'll start with some data that I hope you all are pretty familiar about. This is the statewide point in time count, probably the most popular measure that's used because it is required by HUD, which is the U.S. Department of Housing and Urban Development, sort of a federal agency that funds a lot of the work that we do in Connecticut. And this count is called the point in time count. We also call it the PIT count, PIT, and it's conducted on one night in January in every continuum of care all across the country. And in Connecticut, we do, account for the 2 continuums of care that we have here. And in fact, the count for Connecticut for 2022, I'm not sure the exact methodology. I'm not personally involved in it, but it started last night. I believe it maybe finished up this morning. It's on a single night in January. And so because of that, it's one of those data points that's very useful to compare over time. It doesn't tell us a whole lot in great detail about all the inner workings of our system over time. And, over the course of the year, we certainly serve more people than you see in these column charts here through all of our various programs and the coordinated entry process that we have and housing people and diverting people from homelessness. But these numbers are sort of a snapshot or meant to be a snapshot of the number of people who are homeless on just that single point in time on one night in a cold month at the very beginning of the year. And as you can see, back in 2016, the count was just under 4,000. It was 3,902 folks. Went down in 2017, back up in 2018, and then more steady declines down to January of last year, when the count was 2,594 total people who were homeless on the night of the point in time count. I want to know that this is a downward trend. This is what we want to see. Over time, we want to see fewer and fewer people experiencing homelessness on that single night in January. And that also roughly will correspond to fewer and fewer people experiencing homelessness on all of the other nights and days of the year. However, you'll see that there are external circumstances that sometimes affect the numbers reflected in this count. In 2018, this count was conducted in January, and some of you may recall that there was Hurricane Maria that devastated Puerto Rico in September of 2017, and there were hundreds of evacuees who were being served by our homelessness system in Connecticut at the time of the count. They're included in that 2018 number. When they are excluded, it's more of a steady downward trend, but that's an external, again, sort of an external shock to the system. And, those sorts of things are also possible in the future, and it's possible we're continuing to work through an external shock to our system. So I just wanted to note that the numbers are not guaranteed to go down, regardless of how hard we work, but it's important to, I think, record accurately exactly what we're working with here. And as you can see, things are moving in the right direction. Go to the next slide, please, Carly. The next couple of slides here are, including this one, these are from the HUD system performance measures, just a selection, sort of a snapshot of these. For those of you who are familiar with them, I just want to note that these numbers that I'm presenting are for the statewide system, not for each of the two COCs in the system, the continuums of care, and also that these are calculated for these slides on a calendar year. So they will not match the system performance measure reports that you may see locally that are calculated on a federal fiscal year. So just wanted to put that out there in case you're comparing later. That explains, I think, most of the differences. And if you see anything that's a glaring difference, do reach out to me directly, and I'd be happy to see if we can dig into that for you and help you get an understanding of what we've got. But this is from measure 1.1. HUD has all of our database systems. We have a statewide database that records all of the enrollments and service delivery in emergency shelters and transitional housing projects, as well as our other housing projects. And this number is specifically for the people who are served by emergency shelters and transitional housing in each of these calendar years. And as you can see, the numbers total of people that are served on duplicated counts, I should say as well, each year has gone down, and that there was a sharp decline in calendar year 2020, and then another step down in calendar year 2021, down to less than half what it was in 2016, 4,500 versus almost 10,000. I think a lot of the 2020 and 2021 numbers are probably attributable to our statewide pandemic response changes that we've made to the way that programs are operated in order to keep people safe, especially in the early months of the pandemic before there were vaccines, and social distancing was more of a of the primary tool in our toolbox there, and also ramped up sort of prevention efforts. And also I would have expected to see perhaps longer lengths of stay for folks, but it's not necessarily jumped back up there. So you could see the median, I'm sorry, I didn't put the median, I put the average number of bed nights. The mean on here has been up over 100. And then the past couple of years, it's been in the low and mid 80s for the number of bed nights. And Carlene, if you could go to the next slide for me. Great, thanks. And I believe this is the last system performance measure. No, that's not true. I have one more after this. This is our percent first time homeless measure. This is HUD system performance measure 5.2. This is looking at all of the people who are entering 3 of our different project types: emergency shelters, transitional housing projects, and permanent housing projects, such as permanent supportive housing or rapid rehousing projects. And the green sections of these little donut charts are the percent who are entering, and they had no prior experience with the homeless system in Connecticut. They have no other homeless enrollments prior to their entry in that program. In 2016, we're looking at almost 2/3 of the people who are entering these programs are first-time homeless. And the number goes down. It's not exactly a steady, straight, smooth decline. Last year it was 51%. This year it's 53%. It still is, about 10 percentage points lower than it was in 2016. And also want to note that what is not shown on this chart is the number, the base that's used for each of these calculations, just to keep the chart simple for the PowerPoint. But the base, all of these percentages are based on, is also declining over time. And I think that what that tells us is that our prevention efforts are helping. There are fewer people who are entering projects, perhaps lower amounts of people moving from project to project without having their homelessness solved. There were huge efforts in 2016 through 2018, in particular on chronic and family homelessness, through both of those calendar years there, that also may be attributing to some of the reductions here in the percent first-time homeless. And I know that we've also made diversion from homelessness a huge focus of our system, and households and individuals who are diverted from homelessness are not, sort of by definition, not counted as being homeless, because they're diverted, they're prevented from entering into homelessness. So they would not be, a first-time entry, hopefully. That can resolve their homelessness, and we don't have to, have them come back to us, because that is, I think, the goal here. Just making sure I'm not missing anything on my notes. And Carlene, if you can go to the next slide, please. Thank you so much. And this is sort of the other end. The previous slide had, sort of a snapshot of the effectiveness of our prevention efforts in terms of, a decreasing number of people entering homelessness for the first time. And then this is, on the other side, a snapshot of our outflow efforts, where we're, sort of slowing. On the other side, we're slowing the inflow into our system of people entering homelessness for the first time. And on this side, we are accelerating the output, people who are being who are experiencing homelessness and who are living with homelessness, when they leave our programs, when they are not discharged, rather, when they exit our programs, we want those exits to be to housing, and ideally permanent housing, so that when they, have exited, they've got that sort of stable foundation on which, all of our lives are hopefully built on. So this represents over time an increase, slowly and not exactly steady, similar to the other side, but we want to see an increase in the number of exits to permanent housing. And it hasn't gone up, comparing 2021 back to 2016. It's 57% in 2016 versus 62% in 2021. So there's obviously still room for growth there. And this also, I should say, is inclusive of some different project types. Rapid rehousing is included in here, but permanent supportive housing is not. We do have a different measure that looks at that. It would be a very boring chart because that is the measure of the percent of people who leave permanent supportive housing to a permanent housing destination, or if they are in permanent supportive housing, which is permanent housing because that's in the name, or if they retain that. And that is consistently at 98 and 99% retention rate, or exit to another permanent housing rate there. So that is a number that is very challenging to improve upon when you've got 98, 99% there. And then this, of course, rapid rehousing is quite different than emergency shelter and transitional housing, but they're all lumped together in the way that HUD has defined these measures. So that's why they're all included here. So thank you, Carlene. I'm gonna check the time. All right, so perhaps I've been talking too slow. So I was afraid that I was going to run out of time if I spoke too quickly. So I'll give you guys the quick rundown of the group that I'm a part of. I am a co-chair of the Data and Accountability Work Group of the Reaching Home campaign. We define, measure, and analyze the program and campaign metrics. One of our biggest sort of tasks over the past year or two has been to come up with definitions for rare, brief, and one time. We recently created a dashboard for the rare, brief, and one time measures, and that's what I'll be showing you guys starting after this slide. And one of the current projects that our Data and Accountability Work Group is currently embarking on is to build out a directory, sort of a crosswalk that's going to list all of the various data sources and reports and what's in them and where to find them, and perhaps even some of the questions that can be answered by some of the various dashboards. And we also launched and maintain a website called ctcandata.org that is a public website. I think it's a lot of inside baseball kind of reports and stats and dashboards, mostly for people who do this work. A lot of the people who are participating in this meeting today are probably familiar with it, but it's also a great starting point for people who want to learn more about how the system's working. It's a collaborative effort of many different partners, which are written on the slide in a dark gray font down at the bottom. So Carlene, if you can go to the next slide. Thank you so much. That's not the slide I was expecting, but that's okay. I'm gonna roll with it. So for rare, we have the definitions up here, and I should say also that these are the definitions that we're going to use for the dashboard concepts, and that there will be additional measures perhaps added to the dashboard in the future, but we generally just pick one for each of these three concepts. So for rare, it's the percentage of households that are becoming homeless for the first time. That's going to be lower over time if we're making homelessness rare. And the actual kind of measure that we have on there is the percentage of households that are becoming homeless for the first time each quarter as a percentage of all the households served in homeless projects during that quarter. So there are three groups that you'll see on the dashboard. One is called stayers. Those are the people who are still enrolled in the shelter, transitional housing, or outreach project, that homeless project. Their enrollment is a continuation into that quarter from the prior quarter. We're calling those folks stayers. And it also extends beyond the end of that quarter. And all other entries to homeless. So these are people who have been homeless before, perhaps, or have other experience in our system, and they're entering their project during that quarter. And then there are the first time entries, which are people who they're entering a homeless project during that quarter. And I looked back in time in the system, or not me, but I set up the computer to do that. Looks back in time, finds no prior enrollments for that unique person. So it's saying that as far as our system knows, this is their first time actually being homeless in our system. And then it recalculates that each quarter. For brief, our measure or the definition is that households are going to spend less time, fewer days in shelter if we're making homelessness brief. And the actual measure that we have is the average number of days enrolled in emergency shelter for each quarter for all households served. Ideally, what we'd like is length of homelessness rather than just length of emergency shelter. I think it's important to note that this won't include people who, their length of time unsheltered homelessness or in other homeless settings. Some of that data is sort of challenging to calculate with the enrollment data that we have in HMIS. So I just wanted to mention there that we are aware of some of the gaps and blind spots with this data, but still maintain that it is useful to look at it, certainly as a starting point for brief. And for one time, it's the percent of households who exit homelessness programs, any of our homeless serving programs, to a housing destination who never return to us. And so there's some special caveats to that I'll dive into when we look at it momentarily on future slides. So Carly, if you go to the next slide, please. This is the slide that I might have gotten them out of order on my own printouts. So this is a picture of the dashboard itself here. Got all the data from the Connecticut statewide HMIS system because that is one source that can be used for all three of these measures that we've got. Another reason why we selected just one per, and also want to indicate that all of these are measured at the household level. But we have filters that are, I realize, impossible to read on this screenshot, but you can see it when you visit the dashboard. You can filter this dashboard to show you these stats just at your CAN level. CAN is a coordinated access network. That's the geography that we use to divide the state into service delivery regions, and we have 7 of those. By gender, these are the gender options that are in HMIS. They're I believe the HUD specified gender options in that drop-down list there. Also the number of adults in the household, the number of children within the household. So any combination of those two. Race, all the different race options that are in HMIS. Sort of as defined by HUD. Those are the ones that we're using currently. Also an ethnicity dropdown. Again, those are the same ones using the same terminology that we received from HUD that's built into our system, and sort of the way that that's composed. And then also can be filtered based on time. And it is currently reported quarterly for the past 16 quarters. And I can do the math for you and say that that means it's 4 years of data that we're showing the trends for here. And Carlene, if you can go to the next slide, that'd be great. So just a quick note is that these slides are all screenshots from the dashboard, just so we can focus on one part of it at a time. It's very hard to show like the full dashboard and kind of zoom into it on Zoom. So this is a foolproof way to make sure that there are no technical glitches while I'm talking through what we've got here. So this is for our measure of rare, and you can see that the sort of darkest orange on the columns is the percentage of first-time entries. The lighter is all other entries, and the lightest is the percent of stayers. And these are all of these columns are out of 100%. On the live dashboard, you can hover over any of these columns. That will give you the base numbers for all of these, so you can see the actual numbers changing sort of over time. And you can see a dip there for the percentage of first-time entries in 2020 there. And you can see that sort of in general over the past 4 years, it's been 20% of our households entering homeless programs have been entering for the first time when unduplicated, looking back in our system. And it's typically highest in the fourth quarter of every year. If you look at these trends, the fourth quarter, that would be, October, November, December. I think part of that is the opening of seasonal shelters during that time of year. And then you can also see that the dips are in, the end of Q2 and Q3, and that's when some of those seasonal shelters are closing. And also in Q2 and Q3 of 2020, when we rapidly shifted our operations in the way that a lot of emergency shelters worked and served people. A lot of first-time entries to homelessness just did not, I don't know if they didn't happen or they just weren't recorded here in our data, just because of the reductions in capacity as part of the public health emergency response. And go to the next slide, please. For rare, also, so each of the three measures is going to have one of these, sort of percentage breakouts that will show over time. First, in this case, for the past 4 quarters, and then also for the past 4 years, which is the sort of average of the average percent for all of the data. And it's also broken out by race and ethnicity categories that include the vast majority of the households that are served by our system. Again, on the dashboard, you can filter by whatever combination of race and ethnicity that you are interested in looking at, but these are the sort of the biggest ones that cover the largest numbers of people within each of these groupings here. So you can see for all households, that is literally everybody, all the races, household compositions. There in the past 4 quarters, 17% of all entries were first time for all households. And that's the average there. And you can see it's slightly lower among Black non-Hispanic, a couple percentage points higher among Hispanic of any race, and just under 16% for white non-Hispanic, which is also lower than the all household average. And these differences tend to hold when you look at the same average for the past 4 years. So this might indicate some disparities in the system, based on race or ethnicity. So if you go to the next slide, please, for brief. And so here you can see that in the, something popped up on my screen and it's not necessarily free. In the quarters preceding the pandemic, in 2020, or that started in 2020, rather, the average length of stay in emergency shelter varied. You got a low of about 86 days and a high of 101 days. So that's kind of the first, a little bit more than half of the chart there. And length of stay for households who exited to a homeless destination, that's the red line on there. So these are calculated in a couple of different ways. We have, and I should have mentioned this, so a note for next time I have to present this data. The red line is for people who left during that quarter and their destination was not to housing, or more specifically, their destination was to a homeless outcome, either to a place not meant for human habitation, to another homeless shelter, or another project that does not represent an end to their homelessness, such as housing would. And the green line, green because go, that's where we want to see. So very transparent in the color coding here. Those are the people who are leaving emergency shelter to a housed destination and their average length of stay. So you can see how they are kind of moving together or not moving together, if that's the case there. So I just want to mention that the homeless leavers peaks in Q3 usually, and this also is I think likely related to the closure of seasonal emergency shelters that typically cease operations in late March or early mid-April, which is right around that time. So you'll see a lot of people that are leaving to homeless destinations. I think that those seasonal shelters, again, it's to keep people safe during the winter and the coldest parts of the year. And so there are, there's less of a focus on, ensuring housed outcomes from those places, but it doesn't necessarily represent, a failure to work with people, but it's just sort of, that's why I think they spike at that time of year, part of the explanation. And the average length of stay for households who exit to a housed destination generally tracks with that overall length. And moving along, and I don't have a clock on my screen either, so I do apologize because that is making it harder for me to keep track of time. But I know that I stand between you all and a break. So I'll just note here that similar to the last dashboard or the last measure, there's a summary here for the past 4 quarters and the past 4 years, also broken out by race and ethnicities. The race and ethnicity length of stay are up all around by 10 to 11 days from the 4-year averages. In the most recent year, it's higher than it was in the past 4 years over average. And Black non-Hispanic households and Hispanic households of any race both have longer shelter stays on average than white non-Hispanic households, which again may indicate that there are some differences or disparities there. If you go to the next slide, this is the one-time data, and this chart, I should say, is not perfect. This particular measure is presented is probably going to change in the future, because if you're looking at this as sort of a, excuse me, as sort of a trend, it shows that the percentage of people returning to homelessness is going down, and the percent who never returned, it sort of looks like it's increasing over time, which is not necessarily what's happening. Each of these quarters is the number of exits. That's the percentage there, the exits that happened during that quarter. So more recent quarters, people have not yet returned. Some of these people will return who have not returned yet. So if you can go to the next slide, please, Carlene. So as you can see, kind of helpfully broken it out. Another advantage of doing this as screenshots. Annotated the chart here, and much of our work is funded by the U.S. Department of Housing and Urban Development. So we work for our system to meet and exceed their standards. And for HUD, on those system performance measures that I referenced at the beginning of my presentation, they have a look back period of 2 years to consider when they're doing their calculation for returns to homelessness. So if someone exits to housing on HUD system performance measures, and they do not return to our system for 2 years, but they do return to our system after 2 years and 1 day, that would be 2 years and 1 day after their exit to permanent housing. That would be counted, I believe, as a new entry for them. But for us, the way this is calculated, that would show up as a return of more than 2 years ago. So they would be sort of excluded from the never return. So it's a way that we can see how well we're meeting or exceeding that standard. And when you're looking at this data, checking out those trends from the exits 3 years ago and 2 years ago is the way to go. Looking at the more current trends, that's where you maybe would want to use the filters and see what's happening in your CAN specifically for people who work in the coordinated access networks, to see if it has captured people who are returning to your system, and if that is going up or down, because you would like to see that not increase. You want to keep that gray bar as big as it can possibly be. If you can go to the next slide, please. Almost 3/4 of the households who exited housing more than 3 years ago have never returned to homelessness in Connecticut. And so also, I just want to call it this summary is slightly different than the other one. It's not past 4 quarters and past 4 years. I did the exits from 2018, which is the 4th year of the 4-year look back, and then the 2019 exits. So sort of those 2 years that will meet the standard also set by HUD for 2 years of not returning. And the percentages are slightly larger for calendar year 2019, which could indicate some good news for us, but also, I expect that a small number, hopefully a very small number of these households will return for services in our system. And when the data is refreshed in a year is when we would want to look and compare the 2019 exits to the 2018 exits. That sort of 4-year look back to 4-year look back for a more direct comparison that we have there. So we can go on to the very last slide. The Rbot dashboard is now live. It is live. That's not my typo on there, but it's on the ctcandata.org. You can type in that URL, www.ctcandata.org/rbot, RBOT. Or you can just visit the ctcandata.org website, click that prominently placed green button that says Rbot dashboard. That'll take you right to it. And so if there are questions, I will open the chat and try to respond to them. Also just want to specifically thank my friends and colleagues at Connecticut Coalition and Homelessness for their help, all of the people in the Data and Accountability Work Group, including my co-chair Meredith Amboise, Carlene at PSC, and Chelsea also at PSC for helping to make this Rbot dashboard a reality, and for inviting me to talk at you and to you today. So chat, see if I've got stuff here. You're welcome, Stacy.
Well, there's some questions in the Q&A. I've done the best I could at answering a couple of them in the answer tab, but you have 5 open there, and maybe you can pick a couple that you can answer briefly for everybody and then follow up on the other ones with folks after.
Yeah. Let's see. I'll answer just mark that I'll answer this question live. I've never done this part of it before, so bear with me. I don't know what shows you the question, so I'll just read it. Brian asked about the by name list, and which is relatively real-time data, and how relevant is the PIT count with relation to that. I would just say that they're absolutely both relevant. They're sort of 2 different sources. The by name list is, I think, a better day by day kind of point in time count, but it also is not, certainly in its present form, not a perfect count of how many people are experiencing homelessness in a given day. But that's a good and a fair question, and that I also think will be partially addressed by the that directory that the Data and Accountability Work Group is working on, which will explain some of the differences in the data resources, because there's a by name list dashboard that we have on CTCAN data, but we also have the point in time count results dashboard, which shows those annual things. So that's a good sort of note for us too to think about as we work on that. Let's see. Just want to, I don't have an answer for this question, but I hope that I can keep a copy of this that, so we can look at it later. The question is, how do we account for programs that close due to funding shortages? Do we know how many units we have year over year? Number of resources available declined. I mean, those are all things that we do have the possibility to look at. I also know that, certainly there has been a shift in our system from some of the data that we've got for, like, I presented some on transitional housing, and we have many fewer transitional housing beds now than we did in 2016 when some of the data started. So it's just as the system changes, that will be reflected in the data that we see, but it won't necessarily be considered in terms of the number of people that are served there. And let's see. Someone asked about putting an asterisk for first-time entries when the shelters went to lower capacity. Certainly could do that. I personally don't know if it's necessary to call it out. I think because generally we know what happened in 2020. I think anyone who sees data weirdness at that particular point in time on the calendar would sort of know possibly why that happened, but that doesn't mean that it's not worth including in some way. So I'd like to take that note and see if we can incorporate it into some of the documentation that's sort of yet to be written for how to interpret the dashboard, because that is a good point of context. I do hope that there will be a time where maybe it fades from memory, or we need that reminder for it. And let's see. And Jennifer, your question about inferring from high utilization in Q4 that more households need shelter during cold months, or are these households in need of shelter year round and only able to access in Q4, Q1? That's a good question. I don't know if that's something that we can infer. I believe that most of the shelters that the year-round shelters are running at or close to capacity, but I don't believe that all of them are always. And I think there are many reasons why people would perhaps choose not to seek services or shelter at a traditional shelter where they would be open to being served by a cold weather shelter. So I'm I'm not sure I'm the best person to answer that question, but it is a good and fair question there, because some of the changes in utilization do reflect just changes in capacity that's available over time. So that's why I also was sort of careful to note that when you see those declines seasonally, it doesn't mean that our system has suddenly done something good or better during that specific time period, and that we regress at a different time when more people come in. It's just the differences in the capacity that's available. And last but not least, can the data be broken down by age groups, for example, youth and minors? Maybe. I know that I believe that I have head of household data, and I don't know why I didn't include the household age filter in terms of youth, with the head of household being age 18 to 24 versus older. I'm sure there was a reason that I didn't include it. Might have been a technical bit of weirdness in the dashboard there, but that is noted. The households filters for the members of the household can be filtered by the number of children in the household, and that includes people who are under 18, and the number of adults in the household is only people who are 18 and older. But that doesn't get you at the 18 to 24 for sure. So if you want households of only minors that are served, you can filter to show 0 adults in the household. And then for 18 to 24, there is no current way to get at it. So that's a good question, something I'd like to come back to. So
I'm jumping in right now. Thank you so much, Bill, for the presentation. And yes, the Rbot is live on the ctcan.data.org website. So if you want it, I know that Chelsea put the link on in the chat. So we're gonna take a few minutes break. And so if you need to grab some coffee, some tea, some water, now is your opportunity. And then we will restart the webinar. Well, not restart, we joined the webinar where Chelsea will provide us with an overview of the campaign's legislative policy priorities for this year. And then we'll have some conversation around what to expect this legislative session and how you can help support our advocacy efforts this coming session. So when I say thank you, so sit tight, grab some water, grab some tea, and then we will start in a few minutes. So.
At 10:50. And to get us back started here. I know that folks, I can't see you all, so I don't know who's back at their desk or who is still getting that refreshment or taking a bio break, but I'm going to move us forward so that we can at least end on time today. So once again, my name is Chelsea Ross. I'm the Deputy Director at the Partnership for Strong Communities, and I have the pleasure of taking us through our next section of the summit today. And I'm going to start off with a poll. I want to know, let me launch it here, a little bit about your engagement and comfort with legislative advocacy. So you get a couple of choices. It's not a perfect Likert scale for our survey research folks on the call. So you'll have to forgive me from I don't really know how to engage or feel comfortable engaging in legislative activity, or legislative advocacy. It's okay if you're there. I sort of know, I feel somewhat comfortable. I feel pretty confident and comfortable engaging, or because of my role, I'm unable to engage in legislative advocacy professionally. So I'll give another minute for that. I see, looks like we've got about half of the folks back at their desk and engaging in the poll. There's a couple more. So while other people are answering, it looks like almost, it's a good split between I sort of know how to engage and I feel somewhat comfortable to I feel confident and I feel comfortable engaging in legislative advocacy. So that's great. And then we have a couple folks on the line here who are unable to engage in advocacy in their role. Thanks for sharing that. That's helpful for all of us to kind of gauge that. So as we touched on this morning, one of the critical aspects of Reaching Home is coming together to form and advocate for a consensus legislative agenda. And I'll share Reaching Home's 2022 legislative agenda. Then we'll jump into what to expect from the 2022 session with information and insights and deadlines from Kate Robinson from Robinson and Gallo. Sarah Fox, Chief Operation Officer for the Connecticut Coalition to End Homelessness, was unable to join us last minute today. So Danielle Hughley, who's the policy analyst for the Partnership for Strong Communities, will talk about advocacy strategies and resources and how you can engage in advocacy year round. So throughout this section, please enter your questions into the Q&A feature at the bottom of your screen. I'll do my best to answer them as I talk, and then we'll have time at the to address the balance of them at the end. So I'm going to start by sharing the 2022 legislative agenda. Earlier this morning, I shared during the panel discussion that a key component of collective impact is forming a common agenda. And some collective impact initiatives across the country, in fact, actually most collective impact initiatives don't really engage in legislative advocacy as part of their strategy to address the social problems that they're engaging in. But the Reaching Home campaign has always had that as a cornerstone of our collective impact initiative. And it's always been an important part of the way that we work to prevent and end homelessness. So in advance of each legislative session, work groups identify what action, either through investment or policy change, would really accelerate our progress. They consider who legislative action would benefit, what needs to happen, be it a budgetary change, an administrative change, legislative change, an interagency agreement, et cetera. They consider the fiscal impact of the proposal, the time frame in which it would need to happen, and most importantly, what the impact of the change would be on making homelessness rare, brief, and one time. And they think through sort of how would that change be sustained over time, and how would that change further equity. So the coordinating committee receives proposals from the work groups who have thought all those things through, and then discuss which of the priorities are most critical, strategic, and feasible. I just realized I never advanced my slide. I'm yammering on the intro slide. Sorry about that. I can't really chew gum and walk at the same time. The agenda is a consensus agenda. So the coordinating committee talks about which of those priorities are most critical, strategic, and feasible. And then all members of the coordinating committee work to agreement on the priorities. And so that means if a member is unsure or unsupportive, we work through those concerns until everyone's in agreement. I think maybe Carlene mentioned earlier today, but if not, that the Reaching Home campaign also uses results-based facilitation, which is a formal facilitation process to get people to consensus. And so that's something that a lot of our group facilitators, as well as partnership staff, are trained in and work through. And that's a critical piece of the formation of our legislative agenda as well, because we need to have agreement on the priorities in order to move forward with that one voice that a lot of the panelists talked about this morning. And that final legislative agenda is what we collectively work off to engage elected officials, and administrative leaders with that joint voice flavored in your advocacy by each of your unique experiences and expertise. So before we get to 2022, in 2021, what happened? Reaching Home had 7 main priorities. 4 were successful. You see those at the top of your screen. Preservation of some of the key existing homeless system resources, expansion of some capital resources for the development of affordable and supportive housing, that dedicated match for the youth homelessness demonstration program that Stacy highlighted earlier, and the amendment of state statute to remove barriers for obtaining identity documents for youth and young adults who are experiencing homelessness. And there were 3 priorities which our advocacy were ultimately not fully successful and that we're continuing our advocacy for in some way this session. So for 2022, the Reaching Home campaign has 5 main priorities. We know that we can make homelessness rare, brief, and one time by investing in what works: housing, supportive services, and the people and infrastructure that support our most vulnerable residents. So the agenda includes 3 sections accordingly: funding the state's homeless response system, expanding housing resources, and investing in supportive services for the state's most vulnerable residents. Historically, there have also been particularly challenging fiscal environments where the campaign's advocacy has really had to focus on the preservation of existing funding to maintain the same level of housing and services. So there's been times where the campaign's agenda has really been focused on preservation of existing funding rather than investments, additional investments in the system. This year, the campaign is asking for aggressive expansion, but we're also making it clear that these investments are in addition to the crucial preservation of existing fiscal year 23 allocations in key line items, which I'll share in a little bit. So the first category, as I mentioned, was funding the state's homeless response system. COVID-19 really further illuminated the systematic underfunding of the frontline nonprofit organizations that provide shelter operations and services, homeless outreach, diversion services, rapid rehousing case management, housing navigation, supportive housing operations, and more. So those functions are the real key to our system to end homelessness. Inflation, along with the rising costs of health insurance and rent and heat and fuel, have made it really difficult for homeless service organizations to hire and retain qualified staff. The average turnover rate for nonprofits in 2021 was 18%. And people really left some of the direct service positions for less dangerous in the pandemic, and in some cases, really less stressful jobs. And for those folks who stayed, low wages meant that many frontline staff are relying on social safety net systems themselves. And most individuals fulfilling these essential roles in the housing and homeless service system are disproportionately people of color. So Reaching Home partners determined, with leadership from the Connecticut Coalition to End Homelessness, determined that housing and service provider contracts administered by the state really need a 35.06% increase to account for the inflation rate since 2016. This funding would allow the homeless response system to really work as it's been designed for, to respond to people's housing emergencies, compensate essential workers for essential work, and allow organizations to hire and retain qualified staff. So the coordinating committee ranked this as its first priority for this session. Reaching Home is asking to close this funding gap for housing and homeless service organizations by, number 1, supporting the Connecticut Community Nonprofit Alliance's long-term plan to restore at least $461 million to community nonprofits, which includes housing and homeless service organizations. Last year, the CT Nonprofit Alliance was successful in obtaining a 4% increase, and they're seeking an 8% increase this year. And so the Reaching Home campaign is joining with the Nonprofit Alliance to call for that increase across all nonprofits. The Reaching Home campaign is also requesting an additional $13.34 million in fiscal year 23 across budget line items at both the Department of Housing and the Department of Mental Health and Addiction Services to provide homeless and housing service organizations that funding needed for adequate wages and benefits and professional development for frontline workers, and the increasing rent and utility costs. The next priority on the agenda has been on the agenda for several years. Coordinated access networks are really how we organize homeless services in our state. They maximize resources, they create system efficiencies, and help people resolve their experience of homelessness quickly. So there's 7 coordinated access networks across the state, and they've led regional cooperation and really been a keystone of Connecticut's success. Currently, coordinated access networks, or CANs, as we call them, rely on the Department of Housing's discretionary use of community investment account proceeds for funding. And as an emergency response system, a more stable and permanent funding source is really needed to support its infrastructure. Without that critical funding, thousands of Connecticut residents could be put in immediate risk of homelessness every year. So the Reaching Home campaign is asking the state to provide an additional $2.3 million in Department of Housing and Homeless Services line to provide that critical and stable funding to support the CAN infrastructure and 211. In addition to funding the state's homeless response system, the Reaching Home campaign has said that we need to continue investment in housing resources if we're going to make homelessness rare, brief, and one time. So the rental assistance program vouchers, or RAPs, are a flexible tool, flexible housing resource to address housing insecurity and assist severely cost-burdened renters, including households experiencing homelessness. And RAPs adjust with changes in household income and allow renters to move to locations that work best for their employment and other needs. And RAPs also make up 1/2 of the housing and services combination that we know as supportive housing. Supportive housing is a combination of affordable housing and supportive services married together to help marginalized individuals and families use stable housing as a platform for recovery, personal growth, health, and ultimately thriving. It's designed to serve folks who face significant barriers to staying housed and provides intensive support services. According to analysis done by CSH, 29% of homeless individuals and 14% of homeless families have specific and severe needs that are well aligned with supportive housing. And these percentages translate to 97 families and more than 1,600 individuals in our homeless system that are currently in need of supportive housing. The average annual turnover in supportive housing only results in about 771 available units. It's pretty specific. So you can tell that some of our partners spent a lot of time looking at the data and crunching math. And that leaves more than 900 individuals, an estimated 900 individuals and families in need of supportive housing. And while Black and African-American residents make up only 12% of Connecticut's general population, they make up 40% of Connecticut's population experiencing homelessness and 49% of the families experiencing homelessness in Connecticut. And that disparity is true for Hispanic or Latinx populations as well, making up only 17% of Connecticut's population, representing 29% of folks experiencing homelessness. So this extreme overrepresentation of people of color within Connecticut's homeless population really highlights the direct and continuing impact of discriminatory housing policies and disinvestment in communities of color. And so to address this, we need housing and service interventions like supportive housing that address specific needs experienced by people of color and help them maintain housing stability over the long term. So the Reaching Home campaign is prioritizing a request to increase the DOH housing and homeless services line item by at least $20 million in fiscal year 23 to expand the rental assistance program. And that includes $2 million to support rental assistance to 200 scattered site supportive housing units for highly vulnerable individuals and families. The other side of supportive housing is services, like I said. Reaching Home is requesting that the state increases the DMIS, Department of Mental Health and Addiction Services, housing supports and services line by $2.25 million in fiscal year 23 to expand supportive services to 300 scattered site and development units for highly vulnerable individuals and families with persistent obstacles to maintaining housing stability. So the ask for rental assistance vouchers paired with the ask for services funding is meant to expand the state's pool of available supportive housing units and really serve some additional households experiencing homelessness. Also in that request for investment in supportive services is a request for an eviction prevention program. For highly vulnerable households, we know that eviction leads to homelessness. We know that homelessness is traumatic and expensive for individuals, families, and communities and the state. Evictions are increasing in Connecticut. Legal aid organizations are launching a right to counsel, which was approved in last year's session. But that's further increasing the number of tenants seeking representation for eviction. And a lot of those tenants really need services paired with that legal assistance to maintain their housing stability. So the proposed eviction prevention partnership will assist low-income households that are facing eviction or are at the highest risk of becoming literally homeless without targeted interventions. The eviction prevention program implements a proven eviction prevention model, that coupling of legal services with high quality social work to address vulnerable renters' needs holistically. And we saw this play out in the homelessness prevention program, or HPP, over the last 18 months. It actually launched prior to the pandemic, but then the pandemic hit and it became even more critical that we had a homelessness prevention program in place. But the way that program was funded was through one-time and philanthropic investments. And so that will be discontinuing along with the Unite CT program as that continues to winnow. So there's a real gap in the state around eviction prevention. And we know that. And so the Reaching Home campaign is asking the state to provide $2.5 million in funding to establish and implement that proven eviction prevention model to leverage legal services and social work services to address vulnerable renters' needs. And that's through the Department of Housing and Homeless Services line. And as I noted at the top, these investments are in addition to the critical preservation of existing fiscal year 23 allocations and key line items that fund services, supports, and housing that prevent and end homelessness. So Kate's going to do the sort of all of the things to know about session. But the quick thing is we're in a short session, which is a budget adjustment year. And so that's why we're asking for preservation of existing allocations, because these line items already have allocations in the 2-year budget. So you can see all the line items and their current allocations on the screen and listed in the agenda that I'll share the link to, or Danielle will drop the link into the chat along with the previous 5 items. I also want to note before I turn it over to Kate that the Partnership for Strong Communities also serves as the backbone organization for the Home Connecticut campaign, which produces a consensus legislative agenda that works to address Connecticut's affordable housing shortage. And obviously, affordable housing is a critical component in our work to prevent and end homelessness. So we want to make sure that we're sharing what legislative priorities that campaign is prioritizing for you all, because they're particularly relevant to your work and maybe interesting for you to follow along with and participate in advocacy with as well. So quickly, the Home Connecticut campaign identified 4 priority items this year. The first 2 actually directly mirror the Reaching Home ask for $20 million investment in the Rental Assistance Program, or RAPS, and the preservation of critical bond funding that's captured in that preservation statement on the previous slide in the Reaching Home agenda. So those 2 were high priorities for the Home Connecticut campaign. They also included 2 policy changes to remove barriers to building diverse housing options that I'll quickly share with you. So Home Connecticut supports the revision of zoning regulations to allow as of right and affordable housing near transit and be permitted a density that facilitates affordability to low and middle income Connecticut residents. Transit-oriented development really increases housing stability for Connecticut's households, and it's just one piece of a necessary sort of overhaul of Connecticut's approach to zoning, which can really stymie our housing development and growth to the detriment of equity and the state's economic vitality. Home Connecticut is also supporting legislation to ensure that every Connecticut community contributes to meeting the housing needs of our state, including permitting its fair share of housing for both low and moderate income households. So you can find complete agendas for both the Reaching Home. I went through those priorities pretty quickly. For both Reaching Home and Home Connecticut on our website. We provide links to each agenda. Danielle dropped that link in the chat for you now. We ask that you share these links when sharing the agenda versus sending it out as attachment, because we regularly update information and links within the agenda throughout session. And so this way you can be sure that you're working with the latest version. So you want to head there. We won't be sending it out as an email. So before I turn it over to Kate, I'm going to pop into the Q&A. Oh, that's a big question, Kara Capone. And it's actually, and I see the second is it's Amanda on behalf of Kara. So they ask, the question is, it's my understanding that since the legislative agenda has come out, there's been additional work done around the preservation sustainability of CARES Act programming, in particular outreach, rapid rehousing, and diversion expansions that have occurred to really bring our system closer to scale, facing an abrupt cliff of these resources at the end of September 22. There's discussion about potentially adding the preservation of this programming into the legislative agenda, and an understanding that there may be $300 million in ARPA funding that's unallocated. And this may be a resource we want to advocate for use for this continuation of these vital programs. Am I able to speak to this? I am able to speak to this, Amanda/Kara. So Kara Capone has been one of the folks that over the last week has been talking more about the CARES Act funding. The campaign engaged in significant advocacy over late spring and early summer around CARES Act expiration. And in your question, Amanda, you note some of the areas that CARES Act funding, which is one-time federal funding, has been particularly critical in supporting the homeless prevention system, prevention and response system. And so there is conversation currently happening with Department of Housing and among a couple of stakeholders to think about which aspects we're particularly concerned about ongoing funding, and which we can work with the department and within non-legislative action to resolve. So that's an ongoing discussion. It's something that the coordinating committee will be addressing at their February meeting. So at this point, there's not a decision from the committee to amend their legislative agenda, but they'll be discussing sort of how they want to move forward on that in just a couple of days. But that's why I note, revisiting those links, because things do change as we engage in discussions, especially with the Department of the Office of Policy and Management, and we hear from legislators, and we kind of make adjustments throughout session on our priorities as we hear investments that the administration or the legislature are prioritizing or aren't. So there will be ongoing discussion around that, Amanda, and you'll want to kind of keep in the loop on CARES Act funding. And I do know Danielle's also, doing some work with CAM providers to collect information about the impact of those funding sources in your regions. Thanks for that question. I don't see any other questions around the agenda in the Q&A box, so I will turn it over to Kate. You can feel free to pop questions in, and then you'll of course get my contact information at the end of the presentation as well. So if you have additional questions on the agenda, I can answer those. But with that, I will turn it over to Kate.
All right, thank you. As we go through some of these slides, I'm happy to entertain questions to the best of my ability. But I think it's good to just do a level setting to begin so that everybody's operating with the same information at the same time. And that makes for a more robust conversation. So we are starting the next legislative session on Wednesday, February 9th. This is the short session where budget adjustments are made. This session is only 12 weeks long from beginning to end. And so we will adjourn sine die with any luck on May the 4th. And I was teasing my colleagues earlier that I would have liked to have seen like a Darth Vader vibe or something on this slide for May the 4th. Lots of those jokes will happen as we get closer to that. Individual legislators can propose bills related to the budget, revenue, or finance matters. but not related to policy matters. So it limits the scope of work that gets done. Any bills related to policy members must be raised by committees and or be emergency certified bills. Again, that limits the volume of work so that the chairman or chair people of committees are making the policy decisions in the short session. And this is the time where we make adjustments based on the most current economic data that is available related to tax revenue, expenditures, and federal funds received. So consensus revenue estimates were released last week. That shows us where we are in terms of receivables. And then, you know, the governor in his State of the State address on February 9th will be presenting kind of the whole picture along with his suggestions. And I have verified through Office of Policy Management that the ARPA expenditures and changes to ARPA expenditures will be included in what the governor proposes on February the 9th. And I've been told that it will include additions and subtractions. Advocacy in an election year means that we're playing to outcomes because we're in an election year. Two things are important. One is legislators become much more intentional listeners because they know in most cases they're going to be going out and running for re-election as soon as the session is over. The other thing is people are looking to demonstrate what they have achieved over the course of the biennium. So outcomes are very important. And of course, with the Reaching Home campaign in particular, we are also focused on outcomes. So being able to lift up improvements and changes and meeting the challenges of the last 18 months are going to be very important. The other thing, just to remind everybody, is that all constitutional offices, as well as all Senate and House seats, are up for re-election this year. So that means the governor, Secretary of State, Comptroller, Treasurer, and Attorney General are all up for re-election in addition to House and Senate. And then all of our House members, our congressional House members, are up for re-election as well. I want to hop to the next slide. So again, the State of the State address will be on Wednesday, February 9th, and this is the governor's budget. In terms of state of play, the governor serves and the legislature returns. So after the governor makes his proposal, we'll have an opportunity to review what's in the proposal and respond to it in the form of appropriations testimony. We do not have specific dates yet for the appropriations hearings, but we expect that they'll be mid to late February. And as you recall, during the day, the committee hears from the state agencies themselves, and in the evening, under most circumstances, they hear from members of the public corresponding to what they heard earlier in the day. So we'll keep you all posted related to the specific dates for what we pay attention to as they get released. And then of course, the last day of the session being May the 4th. So just a quick review of where we are budgetarily. It is all about the money. And you're going to hear about the money and see all about the money if you follow any of the press related to the governor and policy in the state of Connecticut. We closed fiscal 2021 back on June the 30th with a surplus. I put surprise there, but it's kind of ironic. We knew that we were going to close with a surplus, but we didn't always operate under that assumption, particularly before we moved into the early stages of the pandemic. The budget reserve fund has the statutory limit has reached its ceiling of 15% of the general fund. And so when we reach that statutory limit of 15%, anything that overflows the banks of that 15% gets assigned to teachers and state employee retirement And if you've been around policy world for a little while, you know that the state is way behind in keeping up in their obligations to both the state employee pension fund and the teachers' retirement funds. So when that cup is full, or when that bucket of the budget reserve fund is full, when the dollars overflow, they go to those two accounts to catch up on arrears. Part of the reason that we found ourselves in a surplus situation is the infusion of federal funds in the form of the CARES Act and the ARPA funds, or the American Rescue Plan funds. And then additionally, there are people paying taxes on Wall Street gains and captures of profit from Wall Street gains, and additional sales tax, because a lot of people are sitting home and ordering a lot of things on Amazon and paying sales tax that way. So current projections are, and again, we have only the updated revenue projections, but they're not held against expenditures at this time. So the revenue projections are updated here, and that for the fiscal year that we are in now, that ends this June 30th, we have a projected surplus of $2.2 billion. And this surplus has grown since we passed the budget back in June, significantly, by shockingly, $2.2 billion. It was a balanced budget when it passed, and we are already in surplus land. That's wonderful news. For fiscal 2023, which begins on July 1st, I believe that should say surplus of 1.9 billion, not deficit. I will double check that before Danielle is done with her, because initially we were projecting a deficit. I think we're now officially in surplus land for fiscal 2023. I'm sorry, that's a typo on my part. I'll do my best to answer that when Danielle is doing her slides. But I don't want anybody to relax that we are smooth sailing for the rest of anybody's careers, because we're not. The way I would phrase the current situation that we're in is that, we got a Christmas bonus or a birthday bonus or a profit sharing check, but we did not get a raise, or, it doesn't mop up our credit card debt. So we're in a temporary status where there is money, and that is an unusual status for us. We have been in a deficit footing as a state since 2007, 2008. So this is rare, but unfortunately, with the projections that we're able to make right now, it is also projected to be brief, and that is a challenge for state policy as a whole and the policies that we focus on. So as you can see, there's just shy of a $1 billion anticipated deficit in fiscal 2024, and a $670 million deficit projected for 2025. Let me just make a note about fiscal 2023. Okay. What committees have influence over our agenda? Importantly, the Appropriations Committee is where we go for the dollars, and where we go for expenditures and programmatic dollars. Specifically within the Appropriations Committee, there are two subcommittees. Conservation and Development Subcommittee maintains funding and oversight over the Department of Department of Housing, and the Health Subcommittee maintains funding and oversight over Department of Children and Families and DEMIS. So the dollars for RAP certificates and DOH administered programs is in Conservation and Development, and for the supportive programs, by and large, comes through the Health Subcommittee. Those subcommittees make recommendations to the chairs, and then the chairs knit the whole budget together across all of the state agencies. The Housing Committee holds responsibility for all policy matters related to housing and housing programs, but the fundraising actually belongs up in or down below in the finance committee. You see, they're just switched there, fundraising and policy. So fundraising is tax collection, taxes and fees. So any fee associated with the Community Investment Act, for example, that is a finance committee initiative or policy. That fee goes through the finance committee. But if there were something to talk about, under what circumstances would somebody be eligible for a program, the eligibility determinations and the policy determinations would go through the housing committee. And if they had a fiscal impact, would then be referred to the appropriations committee. So next slide. So it's important for you all to just have that baseline of information to, so that you're comfortable understanding where we are in the process, why I'm getting an email right now saying call your members of the appropriations committee, or if your local legislator is participating on the housing committee, that if you're getting an alert from us, we want you to have that context. It's also important for you to know if you have a problem, not only to reach out to your individual legislators, but to have a comfort level of knowing where that policy could be addressed and know which committee to go to. And, a lot of people are like, okay, so should I really make that phone call? Is it really worth it? I'm on several listservs, partly because of what I do for a living, but also because of where my passions are. And sometimes, believe it or not, my passions are outside of just, the portfolio of work that I do. And so occasionally I will get an alert from an organization that says, please make a call now. Your voice is needed. And to be 100% honest, in an election year, in a short session, the more people hear through their constituents and their staff people that they're being reached out to on a policy agenda item or on an appropriations or funding agenda item, that is so important. When we had the benefit of being in person, I used to think of this as front door and back door, that in many cases, the community is the front door for legislators and the Capitol is the back door. Now, if you're standing in my shoes, the Capitol is the front door and the community is the back door. But what is so important is that we're both saying the same thing in a timely way so that people are hearing it no matter what direction they're facing in, that they're hearing a coordinated, agreed upon list of priorities so that they have comfort and confidence in what it is that they need to be doing as policymakers. So the question is, how do you all make a difference? And it's very important not only to be a person who vocalizes testimony, but also submits it. And there's no one way to do this. To advocate, I advocate for all the ways to do this and to employ as many methods as you are comfortable employing. So submitting that testimony and or testifying individually as yourself on video or by audio during a public hearing is very important. Calling and emailing your legislators is very important. And then any local gatherings in person or online gatherings that legislators are doing, they really do want to hear from you. As much as we feel hampered by the pandemic, particularly heading into a new election cycle, still being in a modified lockdown environment, makes campaigning that much more challenging for legislators. So showing up either online or in person really, really matters. And of course, repeat, right? Because persistence really does win the day in our line of work.
Kate, we have a question in the Q&A of which is better, calling or emailing. I would venture
All
that
of
the
them.
answer is both.
All
Both
of
of them. Do
them.
them again.
And I take this opportunity to encourage each of you to reflect on what you like to get, right? No two of us have the same communication style in terms of what is the best for us, and legislators are the same way. There's no two will say, do it this way or do it that way. Everybody is unique. And so I would say, to the extent that you are able to employ all the tools you have in your toolbox. And so pulling from Betty Gallo, who is happily retired, but probably colder than I am in Cape Cod. And she was my mentor and predecessor in this role. This was her tagline when she was sending frequent email, which is, a small group of thoughtful people could change the world. Indeed, it's the only thing that ever has. And I think that that's an important quote to share with you. And then I'm a runner. I'm a runner in disguise, but I am a runner. And I liked this quote also, that perseverance is not a long race. It is many short races, one after the other. And the legislative process is a lot like that. We focus right now on the state agencies and Office of Policy and Management and the governor's office. The next phase of the race is to focus on the Appropriations Committee and the legislature. The next process after that is to focus on the leadership. The next process after that is to focus on everybody on both sides, the executive branch and the legislative branch, and all the while to be, communicating with each other, communicating with our local officials so that they can echo what we're saying, and make sure that we're tanked up and, kind of properly fortified and trained for what is, what continues to be a distance race.
Thanks, Kate. Jen Paradis is loving on that second quote, and I am as well. As a fellow runner in disguise, I think thinking about that is like regularly being like, I just need to make it to that tree. I just need to make it to that house. But you have to have the vision of how far you're going overall. And you sort of need both to be successful. So great quote. So any other questions for Kate? You can pop those in the Q&A now. Oh, let's see. Do you expect redistricting, excuse me, to impact advocacy this session? Should we be reaching out to prospective legislators if our districts will be changing?
I would say the answer to that is yes, absolutely. If you know that you're going to have a new senator and or new representative, yes, the answer to that is absolutely yes, because they have to figure out how to pivot to a new group of people. And the first group of people they're going to pivot to is the people they're already hearing from. That's a great question.
So if you have other great questions like that, go ahead and pop them in the Q&A and we can try to answer them. Kate talked about some of the ways that you can advocate. And I think Danielle now is going to talk about, well, how does that really work? How do I really do that? We all know how to pick up the phone or send an email, but what does advocacy really look like? So go ahead, Danielle.
Awesome. All right. Well, as you can see by this first slide, I was supposed to be joined by one of my colleagues, Sarah Fox from the Connecticut Coalition to End Homelessness. Unfortunately, as Chelsea mentioned earlier, she was not able to join us this afternoon or morning into afternoon. But just a quick thank you to everyone who's been with us earlier this morning. I'm going to do my best to cover Sarah's content as well as what we had prepared together for you all. So with that, let's dive right into it. Chelsea gave you all a poll at the start of this conversation to gauge folks' interest and comfort level with participating in advocacy. And it seems like a lot of you are, or a handful of you, I should say, are fairly comfortable with that role. And some of our partners can't engage in it, and others of you are just feeling out your comfort level with it now, which is great. We want to continue to build that muscle. It's very much as our runners in disguise, myself included, know it's all about consistency and constant communication and resharing the same messaging that we've been building together over the last year or several years in some instances. So I'm going to talk a little bit about not only the resources we'll provide for you that we've been building for the past few months, but also the different ways we typically engage during session and beyond session. So first things first, the partnership and CCH, Connecticut Coalition to End Homelessness, work on regularly updating the information of our elected officials and who their aides are at the legislature. This is something that, as Kate mentioned, we're in an election, we're heading into an election year, and there's going to be some changes, as well as legislative aides switching around to manage capacity and make sure that legislators are getting the information they need. So we, in the past, have shared this out to you all, but in finding that the list is usually being updated on a regular basis, we don't want to share out anything that will be outdated fairly quickly or won't get you in touch with the right folks at the right time. So please reach out to the emails provided there, myself at PSC Housing and Sarah Fox at CCH. If you have questions about connecting with your legislators or any aides for any particular reason, we'll be able to get that information to you in a timely manner, so that way you can get in touch with them. Next slide. This is a resource we have been working on and are still just about wrapping up and should have ready for you soon. But as Chelsea mentioned earlier, both of our legislative priority documents, our agendas are up on our website. And we encourage you to continue to use this link when you're sharing it out. And alongside this, we're going to have hopefully embedded into the legislative agenda one-pagers or fact sheets that really dive into the legislative priorities that Chelsea walked us through earlier. So these include, just for your reference, and a lot of these are available on our website right now from past years. So what we're working to do is update data and information based on changes or new information that's available. But we have more information available on the state of housing and homelessness in Connecticut for the year 2022. We are building out a document that has more talking points and details and information on all of the following. So funding the front lines, which we discussed, the CAN and 211 infrastructure that we've been working to build, the rental assistance programs, which we're hoping to uplift, supportive housing as well, and the eviction prevention program. So these are all things you will have at your disposal. We encourage you to share these links when they're available and information with your legislators. It's just some additional information that's available to all to help support why we're coming in with these asks and where that information, what led us to get to that point. Next slide. So this is a quote I found really empowering. Advocacy can be done in so many different ways. I'm going to drop the link that says click here for you all. Please don't leave to go read this now, but I encourage you to go read it at some point today. It's the quote that I pulled is from Melissa Nussbaum-Freeman, and she is the director of a playback theater, which works to elevate people's stories from the audience and then perform them as a way of community conversation and engagement in working towards change efforts. So this quote really stuck out to me, and I think it really encapsulates the importance and the humanity that exists within advocacy. So she says, change in a community relies on private people making their experiences public and sharing it in the community, embracing that. It helps communities become more united because people can hear stories and realize that they're not alone, and to hear themselves in other people's stories. And as Kate said, legislators have all different types of ways of receiving stories. They also go about sharing stories and their experiences in their own way, just as we do. We all have our own experiences, our own expertise. And what we do is we bring all of that together into our collective vision for change, but it takes everybody's stories building into that to really make the case for it. So I'll have us move forward. So when we're talking about sharing your story, who should be included in the conversations that you're bringing to the legislature? I think first and foremost, we've talked about this a lot, but bringing folks who have that lived experience, that lived expertise of experiencing homelessness, having gone through that themselves, they are the ones who know what needs to change most directly. They're the ones who've experienced the hardships that come with it and where the system may not be working in the ways that we hope it is. So having them have the opportunity to share their experiences as a way to create change is can be really empowering. And it's really important that it's at the forefront of the conversations we're having. Some other folks to consider and should be deploying as you engage in advocacy are the folks who do the work every day. So who support those who are going through crisis, those who know the work in and out, who are regularly entering the data. You've got a lot of experts with a lot of different perspectives on why we are advocating for the changes we need. And I would say something very similar for CAN staff. You have a more regional perspective, I would say, than folks who are maybe doing the direct day-to-day work within shelters or in getting somebody housed. But you can see on a regional level what is really playing out, what challenges you're facing in your communities, what are the biggest issues that need to be addressed within the region. I think it adds a different layer of perspective to the conversations we're having. And then lastly, but not limited to, executive directors, as they're the ones who really have the power to steer the organizations they're leading in the direction of the changes we're hoping to accomplish. We talked earlier, not we, but the panel earlier today talked about the importance of shifting power and changing power dynamics through collective impact. And part of the reason that having executive directors as a part of these conversations shows that agencies are contemplating these changes and really working together to see what directions we need to be moving in to achieve change and the change that we know we need to see. So all this to say, in the themes of collective impact, you want pretty much every different level of perspective. You want people talking about it from all different levels of the system, all different levels of engagement with the system, and levels of power differentiation as well. To that end, you want to make sure everyone feels comfortable in sharing their experiences. If you're reaching out to folks in your communities who have lived experience, they don't have to share their stories if they're not comfortable doing so. But if it's something that makes them feel powerful and excited for creating change, and they are comfortable in sharing their vulnerabilities or the challenges that they've navigated, that is something you should all be very thoughtful of. And same goes for all levels of practice. There can be very human, very vulnerable, very personal experiences that come into play in choosing to advocate for an issue that's important to you. So know that about yourself, know that about your coworkers and friends and colleagues, and just be thoughtful about people's comfort level in engaging in these issues. And one way that I found to build that confidence is to prepare talking points in advance. I mentioned those fact sheets that we share, and there's tons of other resources out there that you can look from, but all of our resources will also try and encompass what we know is going out in the world as far as conversations around housing and homelessness go. And really this last point speaks to that as well. We developed these materials from a statewide level, data, trend perspective from what we're hearing from all of you, but that doesn't capture that human experience. So what we put on our agenda is really only successful when you elevate it and bring it to life with your lived experience and your expertise and knowledge. Next slide. So what are the advocacy opportunities that exist during session? These are things that you've heard from Kate. You'll hear them from me now, and you'll hear them from me again. I've said before, building this muscle is really the best way to find comfort in engaging in advocacy. So as we're in session, there are already some virtual tours or breakfasts that are going on within the different coordinated access network regions in different areas of the state, engage legislators and more information, and to have the opportunity for them to learn more about some of the ins and outs of the work that's happening on the ground, and not just from that high level sort of statewide perspective that they often get information in. So continue to engage in those, host them if you haven't already. Another thing you can do is submit written or provide verbal testimony during public hearings. As Kate and Chelsea both said, we put together information that goes out to all of you as fast as we're able to pull it together to provide you with some guidelines for what we're looking to advocate for, what the hearing is going to cover, and providing opportunities for you to share your experience as it relates to that opportunity for advocacy so that you have a starting point to build off and run with. We will also help coordinate materials or share information. So if you have any questions about this, once those action alerts go out, feel free to reach out. We're happy to talk you through it and make sure you feel comfortable with what you're submitting. Lastly, one option, but again, not limited to any of these. There's so many different ways to engage in advocacy, but these are just a few of the top ones that we typically engage in. So sending thank you notes as session wraps up on May 4th for work that any of your elected officials did that helped to advance or support the goals that we're working towards. As Kate said, it's a team effort, and being grateful and sharing that support of the hard work that we're all doing, both in and outside of the legislature, means a lot to folks, and it really helps build that relationship as you continue to work with them in future years. Next slide. So how do you get our action alerts? CCH and PSC work pretty closely together as we build those to make sure advocates have all the information that they need on hand. So both of these links, the first one will link you to the Reaching Home and Partnership for Strong Communities newsletters, which will also include opportunities for action alerts, just general information and resources throughout session and generally speaking. So you can click there to make sure that you're signed up for all of that information. And same for CCH. It's a great way, as Kate mentioned, to just be on listservs and find opportunities brought to you for advocacy on the issues that are most important to you. Next slide. So now I want to talk a little bit about beyond session. This is a short session. It only runs for 12 weeks, as Kate mentioned. So there's very limited time to have conversations actively and regularly with the legislature. We'll be calling them, we'll be emailing them, we'll be having conversations, but they're busy and they're talking about other issues alongside ours as well. So we are most active during the legislative session, but it doesn't mean we're not doing anything when they're not in session. In fact, we're probably equally as busy out of session as we are in session. So I said this before, but you'll keep seeing these things. Keep deploying the same skills and the same advocacy strategies that we see in session, outside of session. There are some other opportunities that are listed that I'll get to in a moment. But again, encouraging elected officials to attend any public events you're hosting, just to continue to engage them and for them to have the opportunity to learn and hear from folks who are directly doing the work, who have had these experiences. As I said before, scheduling listening sessions or tours as best as possible, virtual or in person when that becomes an option again with elected leaders, attending their forums, meetings, panels, press conferences, to engage with what they're passionate about and begin to bridge connections between the things that they're advocating for and talking about with the work that we're doing. Some other things you can do, and these you'll find often happen in the summertime, especially in the time of the pandemic when it's a little bit safer for folks to gather in larger numbers, but there's usually an abundance of rallies, press conferences, and public events that either happen at the Capitol or across the state for issues that are important to you. I've been to many an event outside the Capitol, and it's always really engaging and really empowering. And you hear from folks who are dealing with these issues and working to change some of the social problems we see. So it's a really great way to gain some more familiarity and again, build that muscle. And lastly, something else that is a strategy we can deploy is publishing op-eds or opinion pieces in local newspapers. You can do this for a variety of reasons, to share more information on what is going on in your community, any successes you've had, any challenges you're facing. You can do it in concert with your legislator to elevate their work in lieu of a thank you or alongside a thank you note. But it's a great way to raise the issue locally in your communities or at a statewide level when you really want to elevate a conversation that's going on. And lastly, as I said, we are doing advocacy all year round. So you can see we started the process of building what we've shared with you today back in August. And this was really when we dove into brainstorming ideas within the work groups and taking what conversations they had been having throughout the course of 2021 and using that as a starting point for building what priorities we needed to advocate for or continue to advocate for. As you move into September, October, and November, we're really trying to figure out all of the details we need to make the case for issues. We're getting data, we're gathering information, quotes, personal experiences, resources, and talking points throughout those 3 months, really, and working back and forth between our coordinating committee and the work groups to refine what information is available. In December, the coordinating committee works very hard to finalize their legislative agenda and begin pulling together all of the work that we had been doing the last few months into the resources that I just walked you all through. So now we're in January and we are sharing this agenda out. We are talking through what strategies we want to deploy during session. We're beginning our conversations with legislators. And as I mentioned, those site visits are underway in some regions of the state. Then as we get into February through May, we are in session. So this really takes us through this year, the beginning of session, figuring out if there's any changes that need to come from our legislative agenda or from the conversations we've been having based on what we're learning or where the legislature is hoping to go, submitting testimony, attending public hearings, and final pushes towards the end of session to make sure what we're hoping to see achieved makes it through to the finish line. And then when session ends, we begin the process again, and it takes us right back into August of 2022. We'll be right back at the starting line, trying to figure out where we want to move forward from what we set forth this year, what we achieved, where we didn't see successes, and how we want to take that and shape it for the longer session, which will take place in 2023. So if that wasn't enough information for you and you have more questions, or it was too much information for you and you're still digesting it and you want to talk offline, we, myself and Sarah Fox, who wasn't able to join us, but is always excited and happy to talk with folks, we are both available to you to help answer any questions or make connections or clarify anything that you might not be certain on. So please contact us, stay in touch. We will be working with you all session. We're excited to dive in and work with you all. And I am going to stop there and turn it over to you all in case you have any questions.
I'm just going to note Kate's making some clarifications in the chat that slide 23, which is irrelevant, the numbers, but we'll reflect it before we send out the slides, should reflect that's in next fiscal year at $1.9 billion surplus versus the deficit that was reflected on the slide. Surplus for fiscal year 23, which begins on July 1st of this year. And this is what will be the subject of the governor's budget adjustment proposal on February 9th. Additional questions, if you have them up on your screen right now, is where to send those. I'm also going to launch a poll that looks very familiar to the poll I launched before, which is what's your engagement and comfort level with legislative advocacy now? So Kate gave you the details and Danielle gave you the strategies. So go ahead and let us know how confident those of you who are still unable to engage in legislative advocacy based on your role can indicate that. Hopefully we haven't made you more confused, but as Danielle said, if you are kind of still needing some support or some help, please get in touch and then get in touch throughout the session. So I also like polls because I know that people are still out there listening to us in the world of Zoom. So I can see that people are, because they're completing the poll. And it looks like right now we've got 69% of people who feel confident in how to engage and feel comfortable engaging. And we were in the high 40s before. So it looks like possibly we gave people some tools to make them feel more comfortable, right? That's the goal. We still have a couple folks who don't really know and don't feel comfortable. So up on your screen are some friendly faces who can support you in that. Any last words, Kate? I see you came back on camera. Do you have anything to add before I wrap up?
I just want to put a little sprinkle or cherry on top. We still haven't been notified with specificity about how we are going to be able to engage the legislature, whether the building is going to be open or not. As many of you know, the building is only open to the public 3 days a week right now. And members of the public are limited to only the first floor of the Capitol and the LOB. So we are awaiting instructions and we will share them as they become available.
Thanks,
And
Kate.
stay healthy, everybody. Thank you.
There was a link on one of the earlier slides on navigating a virtual session that we put together last year. Actually, I think Kate put together last year. So that will be a resource to you too, if we continue in that format this session. So if you have additional questions, feel free to drop those in the Q&A as we kind of close here, and advocacy or on anything else you've heard today in the session. I'll also give you one final splash screen of emails and faces. So if you haven't figured out how to find us yet, you will. A couple of folks in the chat have asked if we will share the slides. We will make those edits so that we send out the correct slides. And we'll also send out the recording. So if you have colleagues, I think we're also going to try to isolate the legislative agenda portion, because I know it's been a long haul. We called it the summit for a reason, right? You got to climb for a couple hours. Thank you to those of you who have been hanging through, but it's a lot of information, and the best way to do it is just to give it to you. So you'll have that as well. A reminder that because we just love talking about advocacy and collective impact, that we are also hosting an advocacy listening session later today at 3 p.m. I think I'm putting Danielle on the spot. I think she's prepared to drop the link to that in the chat, or she will get prepared. I see she's getting prepared. Sorry, Danielle, in case you want to join in. And that's sort of an intimate discussion and look at advocacy strategies across the campaign. So it's you all talking instead of us all talking, which is my favorite kind of session to participate in. We're also always accepting applications for membership in any of the Reaching Home work groups. I don't know that we made it clear enough that it is open. There's an open application, and I think I can quickly, Danielle, oh, no, you got, it's not working for me to paste in. So the Reaching Home participation application, but we'll get that to you. So consider, if you're not a member of a work group, becoming one, and save the date. We just, as of yesterday or the day before, settled on a date for the 2022 Reaching Home Award celebration, Wednesday, June 8th. So mark your calendars, look out for a more formal save the date from us soon. Each year we accept nominations. The Reaching Home campaign accepts nominations to recognize the dedication of people across the state who make extraordinary contributions to preventing and ending homelessness, including the leadership and work of individuals with lived expertise of homelessness. And so we'll begin accepting nominations in February. So please look out for that call for nominations and begin thinking of any folks that you may want to recognize. I see in chat that somebody put in an application and never heard back. So Holly will check on that. Those are reviewed as they come in and sent to the appropriate work group. So I'll pass that on to Carlene to look into that for you. Apologies if that was on our end. It may be that we didn't get it. So we'll be back in touch with you. And now what? You met all of us on the Reaching Home team today. We're the folks behind the curtain. If you have questions about Reaching Home in general, Carlene Sharmalis is the Collective Impact and Equity Manager, and we'll be delighted to help you. Danielle, as you just heard, is your go-to on all things advocacy. And then over on the right, Kylie and I are not useless, but if Danielle and Carly can't help you, you're in trouble because they're the brains behind it. But Kylie and I are always available to talk through anything with you, support you, hear what's going on. So please reach out to us at any time. And with 1 minute to spare, which I'm super proud of, or maybe depends on which clock. Nope, on my phone, we're right at 12. Thank you for participating in the summit today. We look forward to working together with each and every person here today to continue making homelessness rare, brief, and one time in Connecticut. And I look forward to seeing all of your faces on Zoom again soon, and hopefully in person soon as well. So have a great day, and I will be in touch with you soon.